forward to engaging with a wide range of stakeholders and insightful contributions on this most important topic. I want to welcome our witnesses who will engage with us later on in this meeting. You're all very welcome. For those watching in, we have Mr. Andy O'Hara from ISKA, the coordinator, Anne-Marie Dunphy, a peer worker from ISKA. From the Rise Foundation, we have Senator Francis Black. From the Family Addiction Support Network, we have Miss Cindy Barry, the family support worker, Miss Gwen McKenna, director and co-founder. From the North Star Family Support Project, we will have Miss Yvonne Lyons, a participant and peer researcher and project worker, and Mr. Joe Slattery, the coordinator. From the Coolmine Therapeutics community, we have Miss Anita Harris, Deputy Head of Services, Miss Suzanne Tackerberry, Recovery Intern, and from the Family Addiction Recovery Ireland, we have Miss Aileen Malone and Mr. Michael Mason of the Steering Committee. Our agenda items today were sent in advance. Before we begin, as this is our first public session, I do believe I have to make a Cathaoirleach's declaration, so it's very exciting. So, in keeping with that, as this is my Cathaoirleach declaration is, I do solemnly declare that I will duly and faithfully, and to the best of my knowledge and ability, execute the office of Cathaoirleach of the Joint Committee on the Drug Use without fear or favour, apply the rules as laid down by the House in an impartial and fair manner, maintain order and uphold the rights and privileges of members in accordance with the Constitution and with standing orders. A quick note on privilege. All witnesses and members are reminded of the long-standing parliamentary practice that you should not criticise or make charges against any person or entity by name or in such a way as to make him or her identifiable or otherwise engage in a speech that might be regarded as damaging to the good name of the person or entity. Therefore, if your statements are potentially defamatory in relation to the identifiable person or entity, you will be directed to discontinue your remarks. It is imperative that you comply with any such direction. I would like to remind members of the constitutional requirements that in order to participate in public meetings, members must be physically present within the confines of Leinster House complex. Members of this committee attending remotely must do so from within the precincts of Leinster House. This is due to the constitutional requirement that in order to participate in public meetings, members have to be physically present within the confines of the places where the Parliament has chosen to sit. In this regard, I would ask any member partaking via MS Teams that prior to making their contribution to the meeting that you confirm that you are on the grounds of the Leinster House campus. As we begin, I might just give some opening remarks. This is their first public session. So we're going to begin this afternoon by saying how genuinely proud I am to take up the role of the chair of this committee. My very first involvement in politics was very obviously not in Leinster House, but it was a community representative of the local North East Inner City Drugs and Alcohol Task Force. And so for me, in many ways, this does feel like coming to a full circle. The fight against the devastation caused by addiction is something that has always been close to my heart, and it's the work of communities that first inspired me to get involved in public life. The Citizens' Assembly on Drug Use was one of the most significant and thorough examinations of our national drugs policy that this state has ever undertaken. Hundreds of people gave their time, their expertise, and in many cases, their lived experience to ensure that this country finally had an honest reckoning with the failures and the possibilities of our approach. I want to place on record my gratitude to these Assembly members, to the advocates and the families who contributed, and also to the members of the previous Oireachtas committee who laid so much of the groundwork that we now see in front of us. Their work should not sit on a shelf. It should shape the future of how we respond with compassion, with evidence, and with courage to the realities of drug use in Ireland today. In the short time since the committee was established, we have been extremely busy as a committee. Amongst our different engagements, we've also, I'm sure many have, listened to the families, the service providers and frontline workers. All of us on this committee have seen up close the scale of the challenge, but also the extraordinary resilience and compassion in communities right across the country. That work is ongoing and it deserves the space to breathe. Which is why I want to raise a concern at the outset. We are told that a new national drug strategy is to be published in full before the end of this year, which will be months before this committee has even concluded its hearings and produced its recommendations. To me, that simply doesn't make sense. It risks cutting across the voices of advocates, experts and community leaders who have been waiting for this opportunity to be heard. So my hope and my appeal to the department is that what is published this year can be treated as an interim framework while this committee is undergoing our work. One that remains open to the findings and the recommendations that will be made from this committee, because if those processes to be real and inclusive I believe any substantive findings from this committee must be incorporated into a national drug strategy. Thank you, everybody. So I would like to move on to welcoming in our first witness today, and our first witness will be from the... Okay, sure. So I'd like to again welcome all our witnesses to begin engagement on our first module and our first hearing in public session. All the opening statements have been circulated to members of the committee in advance and will be published on the Oireachtas website after this session. As agreed, we will limit each opening statement to 3 minutes. Hopefully this may allow the number of different committee witnesses we have to both answer questions from the committee following that. So our first participant is, I have a list in front of me. All right. So our first witness, I believe, is Andy from Uisce. Yeah, Andy, take it away.
So Ireland is embracing a major shift towards a health-led, human rights-based approach to drug use, reflected in the National Drug Strategy, the Citizens' Assembly on Drug Use and the Oireachtas Joint Committee. A core principle of this new consensus is that policies and services must be co-designed with the people they serve. Yet meaningful engagement is impossible without independent support. Research shows people who use drugs often hesitate to voice concerns due to power imbalances in treatment. The Health Research Board highlights that stigma and discrimination block access to essential services, leading to poorer health outcomes and deeper inequalities. Without advocacy, individuals are left to face these systemic barriers alone. Ireland People who use drugs deserve the same protection. Our frontline advocacy consistently reveals discrimination against people who use drugs across multiple systems: healthcare, stigma and refusal of appropriate care, housing, unfair evictions and denial application based solely on drug use, TUSLA, parents deemed unfit without proportional assessment leading to family separation. These practices worsen exclusion and reinforce the cycles of substance use and undermine recovery. And this will continue as long as we criminalise, stigmatise and deny people their human rights. The contrast in Ireland's investment in advocacy is stark. EPIC supports fewer than 6,000 young people in care with a national network of advocates, research and systemic influence. In comparison, there are tens, if not hundreds of thousands of people who are drug dependent, yet advocacy infrastructure for this group is virtually non-existent. Uisce is the only independent national advocacy service for people who use drugs. Despite minimal resources, it achieves outsized impacts. 4,000 plus peer-led engagements and 188 outreach sessions annually. Direct advocacy in complex cases involving healthcare, housing and child protection. Harm reduction leadership, including the lockdown training for over 1,000 people and authoring how to reduce drug-related deaths. Campaigns and events such as International Overdose Awareness Day, Support Don't Punish and the Close the Gap Conference. Groundbreaking research including IREC-funded Agency Access and Solutions Report and digital anti-stigma studies. Independent peer networks with a national framework is critical to the change we're all trying to create. The state cannot simply handpick individuals with lived experience that it finds palatable. This can undermine the very principles of representation and independence. We must be accountable to and provide protection to a broader community who may be reluctant to criticise the system for fear of losing their place at the table. It is therefore deeply concerning that Uisce, the national organisation named in the current NDS, has been excluded from the new committee to oversee the new national drug strategy. National independent organisation like Uisce must be protected, mandated and funded to do this work. We are not a threat, we are the essential partner you have committed to working with. Investing in independent advocacy is not a cost, it is the foundation upon which a truly health-led, right-based approach is built. It is the most effective way to stop the deaths, end the discrimination and finally honour the commitments we all have to save lives and build stronger communities. Thank you.
Thank you, Andy. Our next contributor is Senator Frances Black, who I believe Senator Frances Black is having issues joining in remotely, so we'll move on to Ms. Cindy Barry to give your opening statement.
Thank you. Chairperson, members of the Oireachtas, I represent the Family Addiction Support Network, FASN, operating across Louth, Meath, Cavan and Monaghan. FASN supports families affected by love and substance use, gambling or related addiction. We are a peer-led, trauma-informed, community-based organisation working with the families who are too often invisible in policy and service design. Families are left to cope with emotional distress, trauma, financial pressure, domestic violence, child welfare concerns and burnout. Yet, less than 3% of the National Drug Strategy funding goes to addiction to family support services. Many areas have none at all, and those that do, like ours, are chronically underfunded. At FASN, we provide a 24-hour helpline, weekly peer-led support groups across the 4 counties, one-to-one support and crisis intervention, training and education on addiction, trauma and coping strategies, advocacy with prisons, treatment providers and social services, and counselling for trauma and bereavement. Our work prevents and manages crisis, reduces family breakdown, provides support and education, and improves treatment outcomes at a fraction of the cost of hospital admissions, prison stays, or social service interventions. But we are at breaking point. Despite proven outcomes, FASN continues to operate on short-term piecemeal funding. Staff carry unsustainable caseloads, volunteers face burnout, and demand is rising due to increased cocaine and polydrug use, drug debt intimidation, substance and gambling-related harm, and intergenerational trauma. Without sustained investment, organisations like ours will be forced to reduce services at the very time family needs us most. Our call to action today is to ask for dedicated ring-fence funding for family addiction support under the National Drug Strategy, full integration of family support across the addiction treatment pathway, a trauma-informed whole family model adopted nationally, aligned with Sláinte Care and Healthy Ireland, and recognition of family members as key stakeholders and improved NDTRS data collection specifically for concerned family members. Addiction may start with one person, but its impact ripples across entire families. At FASN, we see how support can transform lives. We are calling for addiction family support services to be delivered nationally, adequately funded, and recognised as a vital part of addiction recovery. With the right structures, funding and recognition, families can move from chaos to coping, despair to hope, and silence to advocacy. They can reclaim their lives, support their loved ones towards recovery, and become powerful voices for change. When families are supported, communities are stronger, and recovery becomes possible for everybody. Chair and members, we urge you to ensure families are no longer the forgotten stakeholders in addiction policy. Thank you.
Many thank you, Cindy. Our next speaker is Mr. Joe Slattery from the North Star Family Support Project.
Thank you to the committee for inviting my colleague and I to share our experience of working alongside families impacted by loved ones' drug or alcohol misuse. The North Star Family Support Project is a long-established and well-trusted community-based service working with individuals and families in the Limerick region impacted by a loved one's drug or alcohol use. Due to the stigma, shame and emotional distress associated with drug use, especially for parents with adult children in addiction, people can go years before reaching out for support. During this time, they frequently withdraw from many regular activities involving extended family, friends, social activities and employment. They are so focused on trying to help the person in addiction and protecting the rest of the family from the impact of it that they are totally unaware of how much they have been impacted themselves, emotionally, physically and psychologically. In many cases, family members are fearful of violence in the home or threats from drug dealers. There are also participants who fear that social services may get involved with their families, delaying their motivation to seek support. Addiction doesn't discriminate and impacts families from all walks of life and social standing, regardless of where you live or how much money you have. The emotional distress and shame are all the same. No one looks at their newborn child and thinks, someday you're going to destroy yours and our lives because of addiction. Their hopes and dreams of how life is going to be for their child is gone, and all they can do now is grieve for what could have been as opposed to what is. There are several services providing supports for those misusing alcohol and drugs, but supports for families are extremely thin on the ground and in most cases poorly funded or provided as a secondary support. The impact of addiction on families is felt 24/7. There is no break. Christmas, holidays, family events like weddings, communions, funerals. The constant worry is always there. Parents, and especially parents Partners and especially parents are stuck in constant emotional turmoil on how best to respond to their loved one. Addiction in the home tears families apart, but due to the severe lack of support available for people in active addiction who are not ready to change their drug use behaviours, the only options for parents is to have to make their loved ones homeless or continue to live in this despair. This is every parent's worst nightmare and something that is not done lightly and usually only happens after many years to try to fix their loved one's addiction issues. Try to imagine the level of despair it must take for a parent to say, "I wish that they would just die so this pain would end. Grieving them would be less painful than living like this. Or I hope the judge locks them up so I can sleep at night knowing where they are. Or I'd rather be dead than have to continue to live like this." Statements like this are voiced far too often and needs to be addressed. On the other side, you have many partners, predominantly mothers with children, stuck in loveless, abusive relationships due to the lack of housing, have no choice but to live in the same home as the person in addiction, living in fear and constant worry of how the environment is going to damage their children and what version of their partner is going to show up the door. These are some direct quotes from participants who attend the North Star. Depression, just didn't have the will to live because of despair and hopelessness. My symptoms changed daily. I never knew from one day to the next what's going to happen and how I would feel. I was in despair and crisis, helpless and powerless, anxious, spaced out and confused, in depression. The activities of the North Star, coupled with a trauma-informed ethos of the organisation, develop participants' self-esteem and confidence and supports participants to develop a range of coping skills that enhance their day-to-day lives, that over time challenges participants to explore and address their life circumstances and personal traumas, fostering independence, particularly through via the one-to-one and peer support groups, access to counselling and a range of other personal development and social options. These are quotes from participants after attending the service. Brought me face to face with my feelings. I had always run away from them before. I am stronger now and I can face things and stand up for myself, which I never could do before. Before I could never laugh at such things. Now I can. I can reflect on my life and laugh at what was at that time painful and terrifying. I'm in a better place now. The past is over and I can move forward. The North Star Family Support Project is extremely lucky that it receives appropriate funding that allows it to provide a wraparound service to families impacted. Yet we are fully aware that this is not the case just in Limerick. It's not just a Limerick City issue. There are families throughout this country who are severely impacted by family members' addiction due to death by drug use, imprisonment by drug use, homelessness, street begging, sex working, drug debt intimidation, videos and pictures of their loved ones showing up in social media who do not have a North Star to turn to. Family members are the collateral damage of addiction.
Joe, we've gone over time now, almost a minute, so I might just come back to you shortly in the questions, if that's okay to finish.
Okay.
Unless you want to conclude quickly.
Yeah, I only have this moment left. In the introduction, they said 5 minutes. I didn't realise it was 3. Okay. So the family members are the collateral damage of addiction, the people who hurt the most, relationships destroyed, bank accounts emptied, homes turned into war zones, feeling bullied and intimidated, made to feel like they are the fault, feeling ostracised by their communities, heartbroken repeatedly with the promise that things are going to change, but they don't. A supporting factor in a person's recovery from addiction is the connections and supports that they have from others, including family. They are supported to work through their trauma and forgive their actions due to their addiction. What most people don't consider is addiction is not a singular issue, it's a family issue, impacting everyone, and everyone deserves the opportunity to recover and rebuild their lives.
Thank you, Joe. Can I go back to Senator Francis Black, if that's okay, from the Royce Foundation? You're very welcome, Senator.
Thanks very much, Ciarán, and thanks for the invite today. It really is great to be here with North Star Family Support Project Limerick and the Family Addiction Support Network and Coolmine Treatment Centre, Ishka and Farry. And I'll try not to talk too long, Ciarán, because I understand that time is precious. So I'm just going to speak very briefly about what RISE does. And I mean, I think our previous speaker has covered exactly the impact on family and how devastating it is for families. So I won't go there. I'll just say a little bit about what we do. And at RISE, we're a primary care organisation supporting families in their own recovery and resilience because the impact is so devastating. And the RISE aim, I suppose, is to help individuals manage the situation and really empower the families to try and rebuild relationships and develop healthy coping strategies and really, to be honest with you, to reclaim a little bit of hope. And we have a kind of a fivefold approach. First is to support families in their own recovery, because families need their own separate recovery from the person who has the issue, who has the problematic alcohol, drug or gambling use. Then we try and educate family members about the impact of addictive behaviours and how it impacts them, not only the individual, but how it impacts them. We try and break the cycle by encouraging self-care and boundary setting. We try and help families emerge from their powerlessness with renewed strength and courage. And really, I suppose the powerlessness can really bring family members into a devastating place, as the previous speaker has said. And then, to try again, we're here today to try and create public awareness about the ripple effect of addiction on families. And, what we do is we deliver, core programs delivered by a team of 8 experienced counsellors. We have an online family programme, which is weekly 3-hour session, one-to-one counselling and an aftercare. So I suppose today, I'm not going to talk too much, to be honest, because I am conscious of time, but today I think it's really important to, I suppose, ask the committee, to recognise the importance of family support as part of a comprehensive public health approach in Ireland. I think that's absolutely vital. I believe we do need a national body like someone like FARI, who are here today, that represents the voice of families affected by problem substance misuse. We need an investment to expand online capacity and to train more staff in evidence-based family therapies. Support for partnerships and treatment providers, primary care networks and community organisations to ensure seamless referrals and holistic care, which is absolutely vital. And I just think with appropriate funding and policy support, we can reach more families in need and reduce the long-term human and societal costs of addiction and strengthen the fabric of families across our communities. So in closing, Cathaoirleach, the Rise Foundation often provides a proven, compassionate and scalable model for supporting families affected by addiction, along with the other wonderful organisations who are here today. So, and I do want to say to all of the other organisations, I work very closely with when they're the Family Addiction Support Network, and I've been speaking to Breda Fell from FARI, and I see all of the other organisations who do phenomenal work in this area. So I thank you for your time and consideration, and I welcome any questions you have, and thanks a million.
Thank you, Senator Black, for your contribution. Our next contributor is Anita Harris on behalf of the Kilmine Therapeutic Community. You're very welcome.
Thank you for the opportunity to address you today. My name is Anita Harris, Deputy Head of Services of Kilmine Therapeutic Community, and I'm joined by Suzanne Tackerbury, a parent, graduate of Kilmine and now a recovery intern, who is using her lived experience to provide peer support to others on their recovery journey. Founded in 1973 in response to Ireland's escalating drug crisis, Kilmine has grown from a grassroots voluntary organisation into a national leading provider of therapeutic community services. During the last 50 years, our organisation has transformed to meet the evolving presenting needs, but our vision has not. We believe that everyone should have the opportunity to overcome addiction and lead a fulfilled and productive life. This vision includes families. Addiction does not only affect the individual, its impact is felt uniquely and differently by all family members, including parents, siblings, parents, and extended family members. This includes children. What we know is children who are at risk of compromised parental care due to problematic substance use need targeted family support. Without it, they remain hidden, unseen and unprotected. Scale of the issue. National figures show us that 1 in 11 children in Ireland are affected by parental alcohol use, Hidden Harm 2019. 2,221 drug treatment cases in 24 were living with children under the age of 18. More than half of all alcohol treatment cases in 2024 included parents, with 3,290 children under the age of 17 directly affected. Kilmine figures reflect this. A total of 2,659 men and women received treatment and recovery services in a Kilmine service in 2024. Together, they had 2,998 children between them under the age of 17. 38% of these children lived with their parent at the time of treatment, 39% lived with the other parent, 14% were in the care of the state, and 7 lived with extended family member, namely parents. These figures reflect only parents who have reached out for help and received treatment. Thousands more remain unseen, children living in silence and uncertainty, underscoring the profound reality of what has come to known as hidden harm. The Hidden Harm Project, a joint initiative between the HSE and TUSLA, provided policymakers and frontline agencies with a vital practice guide focused primarily on safeguarding, protecting and supporting children affected by parental substance use. We recommend that this project needs to be expanded beyond risk identification to include the development of robust protocols and a shared case management framework. By adopting a whole family approach, services can respond more effectively to the complex and interconnected needs of both the children and their parents, ensuring no child is left behind in the recovery process. The current National Drug Strategy 2017-2025 includes important actions aimed at building service capacity to recognise hidden harm and support families affected by substance use. However, these actions again remain largely focused on identifying risk with not much more. We urgently recommend that the next National Drug Strategy move beyond recognition and towards action by embedding a comprehensive whole-of-family approach. This requires significant investment in community-based services to enable early intervention, sustained support and coordinated care responses that address the full spectrum of needs for both the child and the parent. Despite progress, critical gaps remain in Ireland's policy, strategy and practice when it comes to supporting families affected by addiction. These gaps represent real harm to real children. A parent's ability to access quality family-focused treatments and supports in their community is the most powerful form of harm reduction for their child. Yet this support is far from guaranteed. Integrated care pathways cannot exist without services in place. Currently, there is a glaring absence of family-based services that treat the adult while simultaneously supporting the child. Without clear protocols or a shared framework to guide this work, hidden harm will continue to grow, unseen, unspoken and unaddressed. Coolmine urgently call for a national review across 4 key areas. Policy. Most adults in addiction treatment are parents, as seen by the statistics above. Yet their parental role and their children's needs are routinely overlooked in national policy and service design. This silence must end. Practice. Evidence-based parenting supports are not consistently embedded in addiction services. As a result, children's emotional development and safety needs are often left unmet. Yeah.
Is that okay?
That's okay.
Thank you. I really appreciate it. I'll give you more time in the questions, so I promise. Thank you, Anita. I'll now invite Michael Mason to give his opening statement on behalf of Family Addiction Recovery Ireland.
Okay. Thank you. Family Addiction Recovery Ireland, FARI, is the new national organisation which supports anyone affected by someone else's alcohol or drug use in Ireland, whether that person is still actively using substances, is in recovery or the concerned person is bereaved. We give information and support to family members. We link them to available family support services and, where available, local peer family support groups. We also help people recognise and understand the importance of looking after themselves and caring for themselves. As mentioned in the briefing document, we are a collective of both service providers and voluntary individuals with vast experience of delivering evidence-based interventions to both individuals and groups, including peer family support over a number of years. We came together following the sudden demise of the previous National Family Support Organisation to ensure the continuance of a national voice supporting families. When we say family, we mean who people see as their family. It could be their partner, their parent, their child, their grandchild, sibling, their friend, their colleagues, their neighbours, or anyone else we might have missed. FARI's work is underpinned by our 5 outcomes: that families are heard, supported, included, connected, and that families create change. Our vision is that families impacted by problem substance use are supported in a meaningful and effective way that enables whole family recovery. Families' experience and knowledge is part of the recovery agenda and is integrated into decision and policy-making structures. FARI represents them in those structures as equal partners. FARI's aim is to provide strategic and operational direction and leadership across all aspects of family support service work. For us, as a new organisation, this involves ensuring effective governance, reporting and accountability, which is why we are at present in the process of establishing the organisation as a registered charity and a company limited by guarantee. Since the closure of the National Family Support Network, we have endeavoured to be the voice of families in this critical period of Irish drug policy. In 2023, we were requested to represent families at the Citizens' Assembly on Drug Use, where we effectively contributed to the discussions as an organisation and individually, which we believe led to recommendations 14 and 22. FARI support the full implementation of these 2 recommendations and all 36 recommendations of the Citizens' Assembly. In 2024, FARI was part of the lived experience stakeholders for the evaluation of the National Drug Strategy, Reducing Harm, Supporting Recovery 2017-2025. Again, we believe there was about 6 recommendations come out of that and 6 things around the lived experience. And again, we believe we were part of that as well. Fari organised an All-Ireland Family Support Conference, Trauma in the Community, over 2 days in Dundalk in September 2024, in conjunction with FASN. With a small amount of funding granted to the Family Addiction Support Network from the Department of Justice, over 250 people attended, representing both peer family support and service providers from all across the 32 counties of Ireland. A report of all the findings from the 3 World Cafe Roundtable discussions were collated following the conference. There were 6 recommendations from the participants at the conference. The first one, establish a National Family Support Coordinating Body, FARI. Expansion of trauma-informed care training for service providers and families. Enhance availability and access to mental health services. Support peer-led initiatives, diversion programmes for at-risk young people and financial resources for respite, safe places for families under threat. Target young people's exploitation and grooming by drug gangs is a constant stressor for families, resulting in family breakdown. Awareness campaign to reduce stigma and encourage those impacted by addiction to seek support is a significant factor for families accessing support. Following the conference, FARI was launched as the new national body representing family support. Since then, FARI has printed both a full and an executive summary report of the conference, and we can provide PDF copies to anyone who requests them. We are also, in conjunction with Citywide and Ishka, organising the National Service of Commemoration and Hope for bereaved families since before COVID in the Mansion House on October the 11th. We will have robust financial management and stewardship, maximising resources including funder development and engagement. We will sustain and strengthen the range of services and programmes available to families, such as the 5-step method, craft, bereavement support and quality standards in facilitation of family support groups. We champion family rights and the role and contribution of families to services, campaigning for a wider system and service changes and better outcomes for whole family recovery through policy and practice. We will oversee...
Interrupted, but I promise we will get the time back for you so you can conclude that. I know. Thank you, Michael. You're doing great. You're doing great. So I want to pass over to members. So each member will have 7 minutes. You can ask a specific organ. 5 minutes. 5 minutes. Sorry, we're cutting everybody today. 5 minutes. You can ask a specific question to an individual or organisation or speak more generally. But what I do ask is that you leave time at the end for the contributors to answer the question within the allocated time slot. So the first contributor is Senator Nicole Ryan. It's you.
Oh. No pressure. Thanks a million, Kierlich. So I suppose I'm going to start my first question is to Coolmine. So hi, how are you? So I guess how do we balance the urgent need for specialised residential family units versus, I suppose, interventions in the community? How do you see that kind of working?
I suppose at the moment we have neither.
Yeah.
So we actually need both. Currently, there's actually only 2 mother and child residentials in the whole country that gives treatment for mothers and children, and Coolmine do provide them. People should not have to come into Coolmine to take up a Tier 4 residential bed if the supports were in the community. There is a handful of fantastic community organisations that does support the needs of both the parent and the children, but I could probably count them on 2 hands within the country.
Yeah, brilliant. Thank you very, very much. I suppose this other question then is for Fari, and I suppose you spoke about kinship carers needing the same rights as foster carers in your statement. Maybe you didn't get to it, but I've read the statement prior. So I guess how widespread is the issue around kinship care versus fosters, and how do we legislate for that?
I'll actually let Aileen answer that because Aileen would have been involved in kinship care.
How widespread you want to know? Because it's sorry, turn. Oh, sorry, turn around.
I can see you.
It's hard because I like to look at faces. But Nicole, kinship care is often such an informal relationship and arrangement that it's difficult to actually quantify. So I'm going to speak from my own personal experience. So I was a kinship carer for my own grandson, my husband and myself, and we looked after him for about 19, 20 years. But it was only in the last few years that it was officially recognised and that we actually got supports. Speaking from my own experience of family support groups, I do know quite a few kinship carers. So I would say that, let's see, if I think of about 30 people that I have known, I would say there was about 5 of those. So that would be 1/6 or so of that group who were actively kinship caring for usually grandchildren, but often an aunt or an uncle would be caring for nieces or nephews as well. Does that answer the question?
It does. Thank you very much.
Okay.
I really appreciate it. And my other question is for Ms. Barry. So you mentioned that 3% of the drug strategy funding goes to family supports, but do you have any kind of maybe insight into how that is internationally, how that compares internationally?
I wouldn't,
That's
to
grand.
be honest with you. I'm sorry. I suppose we're really just keeping our own heads above the water in our own area and just looking. I just do understand that it's very different in different regions. There doesn't seem to be a national approach to family support, but I couldn't tell you how that compares to other countries.
That's no problem.
Sorry.
No, you're grand. Don't worry. Don't be sorry. It's a technical question. I might just open that to the floor. Is there other countries out there that we could look to of how they support families a hell of a lot better than they do here in Ireland in terms of addiction and family supports?
I think the silent answers itself. So there's lots of studies on how to approach people in addiction, adolescents in addiction, different models out there. No one's ever thought of the families. You know, so there's very little out there other than the research that we create ourselves by the people. But if you take the example, like we get nice funding in Limerick. We can provide a vast amount of support to people come in, and then I tie in with other services like the Family Resource Centre, the South East. They have nothing, and they're coming to us like, what? How is this? But I have a really good relationship with the HC. That they're only down the road. They see what we do. We give them strong evidence, and the numbers prove itself. So he can back us to the next level. Other services probably don't have that same relationship or that ability, and it shouldn't be that way.
Do you think that? Do you think maybe the HC isn't joined up in its thinking across regions and areas, that you have to have a really good relationship with them? No, they're not, but that you have to have a good relationship with them. And like, I'm just thinking, my constituency, Cork North West, we don't have anything. We have to go to the city to get any type of addiction treatment for the person, not to mind the families. Families are just forgotten about altogether. So is it that they're just siloed and do whatever they want in different areas, or?
I suppose our experience is just, I suppose, what that gentleman just said, some other family supports would be well funded. For us, say in the North East, we're continuously meeting with ministers, varied ministers over the years, various meetings like this, you know, asking for the same type of funding, but it just doesn't seem to be a general approach to families. They just don't seem to have that same funding across the board. So we spend a lot of our time trying to keep our head above water, as well as manage the family's needs, and that's so difficult, especially with the rise of drug use and the crisis we're in at the minute.
Thank you.
Just quickly to add one comment. We're lucky in a weird way to live in a very disadvantaged city, and Limerick is. There's a lot more money provided there to give support, and that shouldn't be the way.
Very briefly on that, I suppose that's one of the reasons for a national voice, is to try and where those pockets where people are not funded and not supported and there is no services, that they can be identified, and someone like Farry can speak on their behalf in the local, you know, the local support groups who don't get funded.
Thank you, Michael. We're going to move on to our next topic, is Deputy Marie Sherlock. Before we go to the obvious, we'll get a second round.
Thanks very much, Chair, and huge thanks to the 6 organisations that are here today. I suppose I have 3 questions, so I might just put them out and then people can decide how to respond. Just in terms of the family supports, like it is, you know, network services that are there, obviously it is hugely important that that funding and that recognition of the work that you do, very much increases. I'm interested to hear, though, your perspective as to how it should develop into the future. You know, the extent to which it should be a standalone service or it should be integrated into harm reduction services themselves or the family resource centres. I don't have a view on this, but I can just imagine that I suppose my concern is that somebody somewhere makes a decision, let's say in the Department of Health, on this, about the work that you do and where it's best placed. And I'd like to hear your response about where it should sit in the the system of services. So that's Ceiste Braheen. Number two, just I suppose particularly to Andy and the work in Ishka and the lads at Ishka did a fabulous job. The Sean O'Casey Festival, I have to say, when we saw them 2 weeks ago. Just in terms of the stigma, I suppose, and all the issues, I want to hear a little bit about the GP services and the access piece, registering, and then the opioid stabilisation programme as well. We know not every GP is signed up, so just to hear very briefly from you. And then the last thing, just with regards to Coolmine, the residential, I suppose, mother and child service. The women who were attending that, are they coming from homelessness? Is it lone parents? You know, who is it? Just so that I can, I suppose, better understand who's going, because I think, again, we need to make the case that it needs to be around the country. Anyway, sorry, I've left 3 minutes and 20 seconds for the responses, but I suppose if we could hear, yeah, that would be great. Thank you.
I have a quick response to
Thank you.
It just goes back to kind of looking at like who are the people most marginalised. It's people who use drugs, it's families and communities, and that's like a collective, right? And so we have to have a really strong infrastructure and framework, because they are the people that will identify the emerging issues, identify the gaps, and then guide the collective responses. So to answer your question around kind of, you know, how do we best identify where are the gaps? Unless we're relying on that critical infrastructure, and that's informed by national networks, we'll always be at a loss, and we'll end up having another citizens' assemblies in 10 years, and we'll wonder why did we get here? Because going back to that question, there is evidence on all of the stuff we'll see here today. There is international research. This isn't the 80s anymore. We're not fumbling around. We have the research, we have the evidence, we have the models in this country, but we have to trust in them, and we have to share power. And then on to your next question was just around stigma in GPs and access to GPs. Yeah, look, stigma is massive. It's across the board, and I think we have to understand, first of all, how embedded it is in the system as a whole, and it goes back to kind of how we criminalise people, how we stigmatise people, and that informs people's approach, where they see people use drugs as maybe less than, or that we have to decide for them, and that leads to kind of harmful approaches. And we still have, this is why it's important to do advocacy. We have hundreds of advocacy cases and hundreds of engagements where we know people are being discriminated in GP settings. We know even around the country people can't get onto OAT clinics because there's waiting lists. Now there's responses out there around nurse prescribing which are evidence-based, but they're not being implemented. So again, if you listen to people who use drugs, they will identify where the gaps are, and we will be able to develop the collective responses. But it is about trusting people and believing in their agency to have power to be able to kind of drive forward with the change.
Thank you. Anybody want to answer the family resource or the family support question? Anybody else there in terms of where it should sit in the system going forward in terms of the allocation of resources or beefing up the funding to it?
From my perspective, it's a standalone service.
Right.
It should never be a tier 4 add-on support to someone else's recovery from their addiction. They're very different needs.
Yeah.
If you look at families impacted, you're talking about grief, you're talking about complex grief, you're talking about trauma, you're talking about abuse, you're talking about all these things, and it's great when a person goes into recovery. You're worrying when they're using, you're worrying when they're not. Then they come out and you're tippy-toeing around, and it's all about, you know, to aid their recovery, which is really, I'm an addiction counsellor, by the way, so I'm not anti-drug users, right? But from a family's perspective, they're left with that trauma, that PTSD of what happened when that person was in addiction. Are my windows going to be smashed? Are they going to come in and do whatever? That is a standalone, unique intervention that's provided for them. And a lot of times with that generational stuff, communities in poverty, there is generational trauma, and the parents bring that through, and sometimes it ripples into the next person who ends up in addiction, so on and so forth. They need their own space to work through all that stuff.
Okay.
It should never be connected to anything else.
Okay, thank you.
I'm conscious Senator Black has her hand up to answer the question also.
Yeah, just very briefly, thanks for the question, Deputy Sherlock. I think, and I agree with the previous speaker, I think there has to be like standalone service for family members for their own separate recovery, because, you know, as others have said, addiction impacts the whole family in a devastating way. And it's really important that the recognition for family support and family therapy actually is part of that comprehensive public health approach in Ireland, because the reality is that family members are devastated. Watching somebody you love going down that self-destruct route can really bring you into a very, very dark place. So it's really important that that's recognised. And it's just about, you know, investment in help. And often what can happen if you can really help and support family members, the impact impact of that on, say, for example, if you have your typical, family of, parents and children, if there is one family member that's is lost in that problematic alcohol, drug, or even gambling use, and they're in a very dark place, but the other person, if they get the recovery, that can really impact the children, and it can often sometimes even break the legacy of addiction. So it's really important that standalone service, and I know all the services that are here today do that, which is fantastic. And I know FASN, who do phenomenal work up in the Northeast, really do phenomenal work with regards to their family supports. So yeah, I definitely think it has to be a standalone service for family members, for sure.
Thank you, Senator Blake.
You can ask a question, I'm sure, the next round or whatever. I don't want to eat into anybody else's time, so it's, or whatever chair you want to do.
I'm conscious of Cook Hill mine off twice now, and I don't want to get a reputation for doing that third time. Would you like to answer the question?
Yes, I'll answer that. Alex is probably the best person to answer this about, but just to say, unfortunately, what we have is there should be no profile. Unfortunately, Coolmine are now at a point of where we're looking at most at risk, so we're actually having to go through assessments and what things are falling down to, whose children are most at risk of going into care, which parent is most at risk of. So we have today we have 24 women with children waiting on a bed in a mother and child facility. They will never get a bed. We look for alternatives. There is no community alternatives that provide childcare in addition. So unfortunately, more than likely, we will hear their children have ended up in the care system. Their substance use will get dramatically worse. But I will let Suzanne answer for who.
Yeah, so I think the term addiction doesn't discriminate comes to mind for me, because in my experience in Ashley House, like we had professionals, we had solicitors, we had midwives. We also had people who were lone parents, mothers who were lone parents. We had mothers that weren't lone parents. They had husbands, they had families, they had homes. So there was a wide variety of women in my time in Ashley House. So for me, addiction doesn't discriminate.
Yeah, okay.
Thank you so much. Thank you, Deputy Chair. And next contributor is Deputy Colin Burke.
Thank you very much, and thank you all of you for your presentations. I know every one of you in the organisations you work extremely hard and extremely dedicated to the job you do. I think, visit a total of about 25 individual support services over the last 2 years, and it's a huge education for me as well as regards to work that's being done. And I suppose the big issue that's there, and I think Anita's set it out there, impact of addiction on families, and what can we do as regards, I suppose there's a whole education process there, but also there's the whole need of support for families, and how can we grow that? And I suppose the other thing is the issue of coordination of that support, because I think in Limerick, I think I visited 7 different facilities, all doing a very good job, but all very independent as well. And I'm just wondering whether or not we can do a lot more coordination between the different groups, because each one of them have a part to play and are playing a very important part at this stage.
If I can answer, just I suppose the biggest issue that will always happen with addiction services and children is it lies between 2 departments. We have the Department of Children and we have the Department of Health. So at a policy level, unless we can actually get coordination by the 2 departments in the best way of managing. So one policy is actually conflicting with other policies. So what we have at the moment is, unfortunately, we have addiction services. The Hidden Harm did provide a framework and a foundation, but it just simply wasn't enough. What it did was it delivered training on recognising and identifying harm of parents. So assuming that there's a linear relationship between substance misuse and bad parenting. And what the training involved then was identifying risk, which is really, really important and absolutely vital for addiction services. But what we have there has been a kind of called double silence, where the parent doesn't talk about their substance misuse. The child understands not to talk about their parent's substance misuse. But actually now what we have is a triple silence, because now addiction services are quite apprehensive and hesitant to ask parents about their substance use or their children, which now to me and for everybody that's working here is actually causing a lot more harm than what it was intended to help with.
Okay. But
Yeah, I suppose it was in terms of your first question, how we can coordinate family support. I suppose it's important to highlight organisations like ourselves were born out of no services
Absolutely.
being available
Yeah.
for families. So
Agree
they
with
had to
that.
build themselves up from the ground up. We're specifically peer-led, so everybody in our organisation has, you know, experience of addiction in the family. Not all family support has that across the board. In terms of joined up policy, I think that's where we do need the support of government to step in more so, you know, because we are, I guess, we've built this up, we're trying to fund it ourselves. The need for our services is growing more and more. And I think we need to come together more, sort of like in committees like this, to discuss it, because say our group alone in the North East, we don't have the answers to how to spread it across nationally, but we do recognise that it is needed.
But it's not only the organisations, your organisations, but also the, you know, the likes of, say, the Health Service, TUSLA, local authorities, working a lot more and giving support so that there is that coordinated approach.
In terms of how we work, we do a lot of referrals, you know, even something like the DRIVE project now, you know, how we are responding to drug test intimidation. All of those agencies are coming together, we're getting the same training, we're delivering it, so we're taking a more joined up approach. When there was some funding given to the DRIVE project in terms of the answer to drug debt intimidation, but like you highlighted, there's far more issues as well when it comes to, and just in terms of what North Star said, there's a lot of different other issues that we try and support with our family support groups, the educational programs, how we do that across the board. It's a question, you know, that we may not be able to answer ourselves.
Just the other one that occurs as well, in the sense of someone who ends up in prison, and when they come back out, the support's there even before they come out, and about making sure that they can go down a different road to the road that they were travelling. And I'm sure if we've done enough in that whole area as well. And I'm not sure if anyone wants to come in on that.
Yeah, I think it's a good point, and it goes back to one of the original points is like, what's the best way to respond? And it's important to recognise when we look at like the drug-related deaths, the people, the stats of who they are, the non-fatal overdoses, the prisons, the care systems. It's primarily people from particular backgrounds that are overrepresented there. So it is about implementing a social determinants approach around housing, educational attainment and job opportunities, both as a preventative measure, but then as an intervention later on. Those same interventions will divert people away and away from harmful activities when they come out of prison.
Yeah, Michael.
Yeah, I suppose you mentioned coordination. I suppose one of the things that happened when the National Family Support Network went into liquidation is that very quickly family support people, that's services, lived experience, representatives of different organisations like FASN, like the South East Regional Family Support Network, came together very quickly. So it is possible for a coordination approach. And I suppose that's where FARI came from then as well. People with all that lived experience and from service providers came together very quickly to organise. And it needs a national organisation because, as FASN just mentioned there, it's very hard for them to be doing stuff with little support in their own area, never mind on a national basis. So it needs a national organisation to link in with all the different services. And that's the residential services, the community services, the standalone family support services, but also then the peer support services. It's really important around that.
Thank you, Michael, and thank you, Deputy. We'll have another round very shortly, I'd imagine. Deputy Maura Devine, you're next.
Thanks a million. I met some of you when Deputy Graves had the recovery month. I think it was last week, was it the week before? And it was kind of a very positive idea that yes, recovery is possible, and often we get bogged down in such negativity, and I think that adds sometimes to the stigma, because grappling for services all the time, and it all seems to be a heavy load that you all carry as well. And thanks for your presentations. I suppose if I wanted to concentrate on women in addiction and being the spokesperson for domestic and gender-based violence, I'm very aware that the idea of those vulnerable women in addiction are more subject to violence, to coercive control. And if there is a project, or if there is a specific programme, or how you approach that, because women are often kept in addiction, their children suffer because the male partner has the propensity to obviously own them in some way and to dictate, like a lot of other women who experience it, but this is an awful lot more, I suppose, concentrated on, and that they're in that addiction, they're really dependent on that, and they're kept in that. So how you kind of break that barrier, it's difficult enough to break the barrier and have women to speak out of what's happening at home behind closed doors, but especially in that. And it's not just behind closed doors, also street violence for women who seem to be in addicts as well. They're, they're targets. And just if you could make a comment on that, and the children that are caught up in that as well. I wanted to talk about then the Hidden Harm. It came out in 2019, and it was kind of a breakthrough at the time, and we kind of figured it out. I've done psychiatric nursing for most of my life, so kind of when that came out, it was like, wow, yeah, we've seen this, and it's great to have it down on paper and actually begin to address what's happening with children, and children who are alienated, who are felt left out, who should have never been felt held, I suppose, and secure in the world that they were born into. And yesterday in the Disability Committee, we had the DESH schools in, and they were talking about the difficulties of SNAs, the difficulties of home outreach, where they actually go out to the home and get the child dressed, and the child is so happy to see, because of the chaotic household that they come from, this child is just so happy to see the home liaison officer. It just gives them 4 or 5 hours of normality, of somebody minding them, somebody taking care, and somebody addressing them. So I guess what I'm trying to say is that in certain circumstances, having children is a protective factor against relapse, but mostly it's not. It doesn't hold through for a significant length of time. All good intentions, so it's kind of that child is left in what becomes also an intergenerational problematic stuff. Is there anything else that we can do? Obviously, there's a load of spaces needed for mother and babies, but anything else that could be done in liaison with the education system, because that's where they're actually getting stability in their lives as well. But listen, thank you very much for the work that you do. It's so needed.
Yeah, Anne-Marie, if you
I just want to say, like, for women who use drugs, or especially mothers who use drugs, they're completely isolated away. It's like they're invisible and their voices aren't being heard. And to be honest, I was like that myself until I came to Ishka, and they gave me the opportunity to have my voice and to speak out for other mothers in addiction as well. Like, but there's no services. Like, I'm from the Midlands and I have to travel up to Dublin to Ishka. And like, we're advocating, we're out there daily doing outreach and advocating for women that are in addiction. And all they need is support. They're being punished for speaking up. But if they had them supports in place and they had a wraparound service, it'd be a lot better for them to try and recover and heal. And by punishing them is causing generational trauma. Like, that's what we need to stop. And it doesn't even, it spills out onto our families, our children, our community, everyone. So there needs to be more supports in place. Like, women are afraid to speak out that their kids are going to be took, they're going to be stigmatised, which they are. So something needs to change, because what we're doing now is not working.
Thank you. Any of the other contributors like to address Deputy Devan's question?
I suppose in terms of when we talk about families and children, I think we just need to really, the reality of there is no services. There's 2 mother and child. There's less than, as I said, on 2 hands, community-based services that actually provide services for mothers with their children. There's 0 for fathers. So even that in itself, that there's absolute nothing in existence for fathers with their children. Until that is addressed, you know, we have fantastic National Drug Rehabilitation Framework that actually outlines and puts that forth model system of care.
Yeah.
How we can't integrate what's not there. So unfortunately, what we have is many mothers fully hidden, and we need to acknowledge at a policy, and we talked about stigma earlier. We think stigma and addiction is bad. A woman is even worse, and then pregnancy and motherhood to that actually compounds. So we wonder why people remain hidden, because even if they weren't hidden, there is no service that's there to actually be able to provide a service. And you know, the big people we're not thinking of here, the children have their own needs. Children, when they come into these services, so we may have some services that provide childcare separately for the child. There's no overlap with the service that's providing service for the parent. So we're having two people treated very differently, absolute no overlap. And then there's wonderful parenting programs. You know, one of them is the Parents Under Pressure program that is delivered. Again, most of these programs, it's geographical. So if you have a really active CHO area, that is really, and they, you know, they will fund they're very specific funding. It could be specified to Dublin North only.
Right, yeah.
Cannot avail of people for Dublin South because it's actually not within their funding. So what we have is we have the types of parents under pressure who do recognise as parents living in the community, they just need support. They need wraparound supports. And just in my experience, I've worked with women my whole career. Addiction is the least of their problems. So actually when they come in, we look at the substance use. You know, you say, no wonder they're using substances. It is domestic violence, homelessness, trauma. And we can't ignore it.
Thank you, Anita. Thank you. Yeah, Aileen, of course.
Very quickly just say something. You asked if there was some Department of Education can do, and it occurs to me too that we're linking children with women who are in addiction and who have already sought help. What about all those hundreds of thousands of children out there whose parents are not seeking help? After school clubs, I mean, that is something that we don't provide here in Ireland very often. But if we have somewhere for children to go after school where they can be minded, where they can get a hot meal, where they can take part in activities, and where there are stable adults to keep an eye on them, that helps also identify children who are at risk, and so then that they may be helped. And breakfast clubs as well.
Thank you, Deputy Dewan. Next contributor is Deputy Anne Graves.
Look, I think I've met many of you and visited many of your services over the last couple of months, and I think, you know, that along with today's meeting here is the only way that we really know what's happening on the ground. So welcome to you all. Chocolate Divine mentioned the recovery event last week, and many of you participated in it, and it was a really positive thing. But I think what was most important, and it's something that's been brought up here today, was for us to listen to the lived experience of the people that spoke, you know. And it's all very fine. I've read through all of your presentations today in detail, so I'm only going to ask a few kind of generic questions. And what struck me from meeting you and really from your presentations today is really how important family support and peer support group is to recovery. And that should be central to any policy, you know, and the strategy that's forthcoming. One thing, and I think it might have been Andy that said it, the state simply can't handpick individuals with lived experience and that it finds palatable, and 100% I agree with you, it might have been Joe. So look, that's true right across the board, you know, and I think that the voice of those that are affected by drug use need to be listened to and also considered as part of the strategy and the work of this group. But one thing that I want to say, a lot of the visits and feedback that I'm getting from groups, and even here today, is about funding. Unfortunately, we don't have a role in funding. We won't be making a presentation on the budget next week or whatever. I have advocated in the Dáil, you know, for multi-annual budgets for everybody. and we may include something in the final report, but we won't be looking for money in the budget. We can't. It's not part of our remit. So that's just something to be conscious of. And, you know, on that vein, like, I'd like to hear from you all. I'm not going to, or anybody that wants to speak on it, how this committee can support your work and ensure that your experiences is reflected in policy, because at the end of the day, that's what's going to change things. So policy driven, you know, I'm a firm believer in practice to policy, where the experience of your projects and the people you work with is reflected in government policy and practice. And that's how we will get things improved from the point of view of this group. So the questions I would have is, number one, what can we do, you know, to get you involved in the policy development? And number two, and this is something that's come up quite broadly, how can we ensure that services are delivered outside of the Dublin area? There's a huge amount of groups where there is nothing available, and I mean nothing available for people that are suffering. And the idea that drugs only exist in Dublin, like, is crazy. Every single village in town is affected. So that's the second one. And then finally, and it's probably in follow-up to women in addiction, how can we encourage and improve their access to services? Many of them won't go or can't go because they're afraid their kids will be taken off them if they access services, or in other cases they're shoved into prostitution to raise money for maybe a family member that, you know, they're feeding their habit. So they're just three brief questions. I could have 100 more, but the other thing is, if any of you want to contact my office, please feel free to do so.
Thank you, Deputy Graves. Yeah, Andy? I think what you've heard today is families and people who use drugs telling you what works. Like, we know from our outreach and we know from working with the families, we have far higher engagement than other groups because we're autonomous and we're peer-led. Right? So we know what's going on across the country, or even anywhere we are. So, and it's the same with the families. And if we think back to when the National Drug Strategy or the task force were first developed, there was a recognition that actually there's all these groups that are marginalised and excluded. People use drugs, families and communities, and they need a community development approach, and we need to fund it. So we need to mandate that there's independent, autonomous peer networks for people who use drugs, for families, and for the communities, and they work in partnership then with the state. Yeah. So again, it's very clear that if that's ad hoc or it's tokenistic, or someone is deciding whether you get funded or not, if you say something that gets pulled back, it will never work. Yeah. It has to be agreed and it has to be mandated. And just to be fair, it's what all the evidence says about civil society. It's what all the evidence says about how autonomous peer networks work. So if we want to do this, there's a very clear way to do it. I'm just conscious that Anne-Marie might want to say something else about kind of women and families and giving women a voice.
Yeah, it's just women out there, they're afraid to access services, obviously, because their children will be took, but a lot of it is the stigma that comes with it as well, and some of them are coming from domestic violence relationships, so they're finding it very hard to trust people that they don't know, and I think that's where our peer outreach comes in. Like, we're able to get to women that are afraid to speak out, and we're able to be their voice, and they have that trust in us to go back to Andy with the issue and set up advocacy cases that way, knowing that, like, they're not going to be reported to us, that their kids aren't going to be took, that they're going to have that opportunity and that chance to do what they have to do to keep their kids. So,
and then on that, and getting people again to be directly involved. Like in Ishka, where our model is, we have a peer partnership with change framework model, and it's set around the goal is the achievement of social change, and there's a participation spectrum and model that we implement to make sure that people themselves are identifying the issues and they're the ones speaking from them. It's not just, say, me or Anne-Marie, and it's not just people who are in recovery, it's everybody. There's not a condition that you have to be a certain amount of drug free. You have human rights, and you have a right to participate now, and you right to have a voice now, and then you have a right to deliver that message yourself directly to policymakers. Thank you, Andy.
Just add what you can do is, you know, anyone that's done any addictions course will go through all the policies that were made over since the 80s. Ireland has really good policies. They're never enacted on. So what you can do is hold people accountable, or what has been documented as the best way forward for people and families in addiction, and make sure they follow through on those actions. And if they don't, like they haven't from the 80s, people need to be made accountable. That's what you can do.
Thank you, Joe, and thank you, Deputy Graves. Senator Van de Kull.
Thank you, Chair. I'm afraid I'll miss the second round, so I want
That's
to, where
okay.
possible, have the witnesses take most of my 5 minutes. Anita, the Parents Under Pressure programme is brilliant. And I just wonder, everybody has mentioned family support. Is that something that could be rolled out nationally by all of the various groups that are doing really good work for families?
Yeah, so the Parents Under Pressure programme, just to say, that was taken into Coolmine in 2014, and it's an Australian model. And when we rolled that across Coolmine programmes, there was such a demand outside, say, does people need to go to Coolmine, or do people need to be in addiction to actually get this model? Does it apply to people with domestic violence, mental health, parents under pressure? And yes is the answer. It was specifically designed for parents with substance misuse, but also for kinship carers, grandparents that are now raising the children. So in Australia, where when this was developed there was a whole missing generation of parents in certain areas, and it was the grandparents that were raising many of the children. PUP at the moment there's over 400 people trained practitioners across Ireland in the last 2 years on the PUP.
Are they all working? Are they all actually delivering the programme, or are they just trained
They're all
up? Yeah.
external to Coolmine.
Okay.
So these are TUSLA, social care workers, family support workers, family hubs. Again, it's not consistent. It's again dependent on the task force in the area, or dependent on whatever area, if they place importance on it and they decide to train a number of their people. There's some areas in Ireland that have lots of people trained in the PUP approach, but then other parts of Ireland that have zero. So it's not a consistent support, it's not a consistent approach, but it absolutely is a framework where people are hesitant when working with the hidden harm. Where services are very hesitant and going, do I work with the child? Do I work with the parent? And how do I do this? Here's a framework that will show you how to work with both.
Yeah. I've met people who have gone through the Parents Under Pressure programme, so I just wonder if we are, trying to raise awareness for it or roll it out in some way. I presume you have evidence-based around outcomes, positive outcomes. Can you tell us a little bit about the outcomes?
We do. So I suppose there's a large evidence repository of randomised controlled trials all over the world, so Australia. But when it was brought to Ireland back in 2014, Trinity College carried out their own, Dr. Joanna Ivers, to see would it work in an Irish context with an Irish cultural aspect to it. The evidence was absolutely, the significant differences in lower levels of depression, anxiety, stress, confidence, increased levels of confidence, and the quality of care given. So what's central to the Parents Under Pressure programme is the recognition of, in order to support the child, you have to support the parent. Actually, the parent can be that person. And actually being able to measure capacity to change. So actually after and following doing some work with parents, if they don't have capacity to change, actually making decisions about actually does this child need an alternative carer for a period of time, or actually this parent does have full capacity but there's so many stresses and pressures and we need to, so it's an active case management model that now establishes what supports need to be put in place, what's available, and actually advocating for when they're not available. And people mentioned earlier, the after school clubs, the home liaison. Again, they're specified to some areas. And I think we need to recognise communities have changed. And many years ago, there was disadvantaged areas. I came from one. I know that's no longer disadvantaged. It's still considered, but actually elements of that area are actually really highly privileged people because they've started building around these areas. So I just even think when we talk about community now, and I'm delighted Anne said it there, most people from Dublin have moved outside of Dublin because they can't afford Dublin. So we now have that urban boundary has been expanded right in with zero services. Yeah. And every county in Ireland is affected by substance misuse. Yeah. So I really, for Parents Under Pressure, again, a lot of services that are trained in it are in specific areas. But actually, why should somebody from Cavan or Leitrim or not be able to avail of Parents Under Pressure? Why should they have to go to Dublin?
And just maybe
Senator
one last question.
Senator Black has her hand up as well to answer your question.
Yeah.
That's what we can take one. Senator Black.
Thanks very much, Ciarán, and thanks for the question. I hope you can hear me okay. I'm only picking up some of the questions, so forgive me for not coming in a little bit more. But I was just very interested there in your question, and the last senator there asking about the model. And I think like what RISE does really is an online program where we have a one-to-one service. We have a 10-week family program. And we have an aftercare program. And that model works very well when you work with FASN, for example, in the Northeast, and, you know, or any of the other family addiction support networks, the peer-to-peer support groups. So what say, for example, what FASN does is they would refer, because we have a team of 8 therapists who are, you know, trained up specifically in the impact on family and working with that person individually. So FASN would refer family members to RISE, and then they would come to our 10-week family program. And again, it's all online. So we have 3 family programs running at the moment, where there's 12 family members, individual family members, not all from the same family, where they come to us, and they're obviously, as other speakers have said, that they're in crisis. So they do the 10-week family program, and then we would refer back to others. And we also do a lot of, I suppose, we do a lot of surveys. We you know, for example, our new 10-week crisis intervention, 10-week counselling service, we just did, and we also do surveys on our family programs. It's all evidence-based. So, you know, and the recent report really summarised, it was a survey conducted with participants, family members, after completing 10 counselling sessions. And I suppose it really highlighted the positive impacts on their mental health and their coping strategies and their awareness and overall well-being after the 10-week. We weren't sure if 10 weeks was enough for the family member, but it really was. I suppose the survey was designed to measure changes in the client's perspectives and behaviours as a result of the counselling process. And we were really amazed at the results that we got, and we saw that before counselling that, you know, the feelings of despair and hopelessness were really prevalent, with over 56% feeling really, really lost and in that trauma, and they had no really support. But then after counselling, that feelings of despair and hopelessness decreased dramatically. I think it was like 36.8 for experience, and that, you know, they didn't feel that anymore, and they didn't feel it hardly at all. And then obviously having that extra supports and the understanding really increased significantly. I think it was 47% feeling supported most of the time. And then their confusion, the feeling of confusion and trauma reduced. So, you know, there's a huge kind of benefit, I think, to kind of those pre and post surveys that we do with our family programs as well as our 10-week family program. We're hoping to do kind of evidence-based with our aftercare as well. But for us, it's like some family members come in, they do the one-to-one counselling, then we refer them on to the 10-week family program, and then the aftercare is where the real work. And when we refer back to the Family Addiction Support Network, the family member has gone through a very intense therapeutic process with the 10-week family program, and then the Family Addiction Support Network, they'll go back into the peer-to-peer group. And it works very well. It's a model that works very well, and we're hoping to expand that to other services as well. We're hoping to get a meeting with the South East Family Addiction Support Network as well. So it's working very well, that model, and we're seeing unbelievable results. And I'm sure FASN can say a little bit about how the model works as well.
Thank you, Senator Black. Senator Quillen, I'm conscious you were very good and asked 2 direct questions. So,
I just had one more, and it relates to the statement earlier around addiction not discriminating and, you know, not picking its victims. I just wonder, in terms of family support, I speak as someone who saw my younger brother go through addiction for 15 years, and we did lose him to suicide, so it wasn't a happy ending. But my question is around, you know, I'm not from Dublin, I'm not from a disadvantaged area. Are you seeing people, family members, try and access facilities and supports from all walks of life? And are you seeing that across the country? I'm from Kilkenny, so I suppose the South East, but just are you seeing it from all walks of life and all corners of society?
Yeah, I would absolutely say that is the exact statement. It does not discriminate. We have and I don't like to put people in different boxes in terms, but from everybody, you know, all parents, family members, it doesn't matter what walk of life. You know, you have family members that might have people in prison, you have professional people who, the young people is getting caught up in drug deaths. We have everybody and anybody contacting us, you know, mostly parents, sometimes grandparents who have to take over the care of their grandchildren because of their son or daughter is in addiction. I mean, you could sort of sit here and write a book about the different realm of people, but it does not discriminate. Everybody is trying to step forward for help, those that do, especially people that we have families coming forward that don't have loved ones in treatment. You know, so we will have a lot of HRB stats in terms of people in treatment, and then that can link into, you know, family members. But I just want to say that on that, I know I'm just going off course a bit. In the HRB, where stats are gathered about people in addiction, there isn't enough, I suppose, space given to gather information about families. So we're working with families. We can give very detailed cases. We collected it all in-house, but it's not being fed into the HRB because the HRB is not allowing us to put in the details on behalf of family members. So you guys could be fed in terms of what are the actual issues that family are facing, whether it be mental health, dual diagnosis, you know, drug debt intimidation. You know, the place isn't there for us to feed in to let you all know exactly what families are facing on the ground. And unless we have meetings like this and we're asked directly that information in terms of what families from all walks of life are experiencing, that you get to hear that, and then policy can be met around that. Does that make sense?
Sorry, I'm just going to have to, I just want to make sure all members actually get to ask their questions. That's okay, and then we'll come back at the end to make sure you hear more. Thank you, Senator. I'm going to move on to the distinguished guest of the committee, Mr. Deputy Rory Morku.
Gurmaiga Cahirlook, the Fulcher Roof Gilair. You know, you'll be a long time name checking everybody that's here. Look, I think you've laid it out fairly straightforward in the sense that I think Joe and Andy almost had spoken a fair bit about everybody knows what to do here. You know what I mean? The best practice is known and just has not ever been implemented to any degree. In fairness to Anita made the point, if you know what I mean, where there is no service, if you're talking about obviously women in addiction, and in fairness, Anne-Marie spoke as well in relation to that, right? So I suppose it's you need to make sure that there's a strategy, but a strategy means a plan. Like, we all talk about multi-agency, but we all know that departments don't talk to each other, and even sometimes they only do when they say that's not my responsibility. And obviously here, a big welcome to Cindy and to Gwen. Obviously the FASN operates out of Dundalk, and it does a huge level of work. And I think one of the things I would always say about it, like, I've been at a number of fundraisers that they have done, and the fact is half the time these fundraisers are organised by guards. Like, you still have Christy Mangan on your board. That's a former chief superintendent, and it was on the basis that they provided a family support sort of system that the guards were not capable of doing, but they saw as being absolutely necessary. And I would just, you know what I mean, I would ask that they would actually detail in relation to probably the low cost of their operations, but how they have constantly fallen between the Department of Health and the Department of Justice. And we all talk about the need for multi-annual funding. We've also seen sometimes a corporatisation in relation to how the state operates and, you know, who it actually engages with. And while we all want to see best practice and governance and all the rest of it, sometimes we lose that community dimension. And in fairness, most of the organisations that are here have been built on the basis of need because the state wasn't providing it. And in fairness, I think the biggest point that was said is a network was formed, but what you really need is the state to provide a strategy in relation to family addiction supports, and then beyond that to be able to actually facilitate a network of those that are there. So if you could tell your own case, I think.
Actually, in 1997, I think was when addiction rose its head in Cavan, and we went looking for help. We couldn't get any help. There were no services, and we weren't even referred to Al-Anon or any place like that. Never ever heard of it even at that stage. So we came to Dublin. They were doing the marches at that time in Dublin, and we met up with like-minded people who were our lifesavers and helped us to do that. So all of our services have developed because of the people in need, and when they come to us, we listen to what they have to say, what they need in the region there, and we do our best then to supply those services. So we have a wonderful board of management, brilliant staff. We have 15 trained facilitators who've come through the peer support groups themselves, so they have the lived experience, but they also have level 6 facilitation skills, conflict management, and the 5-step therapy. So we're very cost effective in the
value for money.
Value for money, that's it. But at the heart of it all is the family members and what they go through. And we do not see family members as victims. We see family members as people in their own right. And when they get their support and their education, we work with Francis, the CIPSIs fund us to deliver a programme. Francis, then the 10-week programme is done there. I think in 24 we had 39 people gone through that did the programme. And when they come back, they've made changes in their lives, they've discovered new things, and they come back and into the peer support group. That's where everything goes back to, is the peer support group, because you can maintain your changes and you can live your life there. And through that, then, it's about giving back into the community. The stigma is horrendous. People are, I suppose, based on my own experience, I would have said, don't go down near that family, don't get in touch with this, or don't be a part of that at all. But when it came to my own doorstep, it opened my eyes completely. And so now we're the voices for the families in the North East. But we can't do this on our own. We don't do it on our own. We're linked in with FARI. We're linked in with all of the agencies in Dublin as well.
Okay, thank
so
you. Thank you, Graham.
I think that's where...
Yeah, Andy and then Michael. Yeah.
Just come in on that, I think it's really, really important that there's one element that's kind of been left out, and that's the lived experience and the voice of the lived experience, whether that's families or service users, and they're not at the moment at the policy level, at the implementation level. We've been excluded from that, and that needs to be implemented as well. You've also, you mentioned at the very beginning that you're going to have a report in 9 months that talked about a new national drug strategy in less than 6 months now, and there is no input from the lived experience, from families or from people who use drugs. They're not in there. They're not there as part of it, and that's really, really important. And we also spoke, and PUP is an absolutely fantastic programme. There are other evidence-based programmes that are run right around the country, whether it's 5-step, CRAFT, lots of different ones. The ones that Francis in the Rise Foundation that they run. There's ones that Joe runs in Limerick, but it's all postcoded. It was asked there a question, are we seeing people from every part of society? We are. Families need it, and different families need different support, and different support needs to be available everywhere. And that's really, really important, and it can't be postcode. It has to be available right across the whole country and available to everyone.
Thank you, Michael. And you'd imagine you had something to say in that as well.
As Mick said, it's a geographical lottery at the minute. But just to clarify as well, and to reframe something, like as is being said here, we have it. Most of our actions and our understandings are based on a moral crusade against people who use drugs and the families come from, where we end up punishing people and we see them as the problem. We need to shift that narrative. And you've heard today, and the evidence is, like, people who use drugs and their families are the solution. And they have a structural analysis that nobody else has. It's what the system is crying out for. We need to build the responses and the solutions around that. And I would just go back to some of the things that's been mentioned. Stigma is unbelievable, and it goes across all classes. The amount of people who aren't speaking up and who aren't having a voice and aren't getting the support they have can get because of the stigma. And we were doing a bit with FARI, and we went back to the peers and we said, look, just want to do a piece of work with FARI for the national event, and they were like, yeah, definitely. And one person just said something that I thought was powerful. He said, come here, he says, when we had no voice and we were dying in our droves in the 80s and 90s, it was the Maz that stood up It was the Ma's that marched the streets. It was the Ma's that demanded the service, and that's why we are where we are. And it is about asking ourselves why we're kind of still seeing the high level of deaths and the high level of harm, and people who use drugs and families still saying we're not being listened to. Like, we have what we need in the kind of the networks that's there. We need to just build stuff around it and rely on it.
Thank you, Andy. No more.
I wasn't. They said the North Star was built by people in the north side of Limerick City, mothers who come out and created that project, and now it's 18 years on and covers Limerick City and Limerick County because of those mothers.
Amazing. I'm conscious next on the slot at the moment. We're also very conscious of the patience of Senator Ryan and Deputy Chair. But if you want to come in and ask some questions, I can come in. I think we'll have enough time at the end anyway, but if you want to come in first.
Sure, thank you. I guess my question is, it's open to everybody, but like around tokenism and national drug strategy, I would have worked in like drug services, which I'm going to say were nice. You know, they were the standard drug service. And nothing, I think, could have prepared me for working in a low threshold homeless service and how different that was. And like working with groups maybe who were migrant and who were from the travelling community, and just seeing the shift of how, you know, like maybe the Gardaí services outside of that would treat them. And, you know, we've had, you know, the government saying that we've had input from all different types of groups and stuff like that. But I think sometimes groups like that are just almost a token, like a box ticking thing. Right, we've talked to them, that's grand, that's covered. How in the national drug strategy, and even in our own kind of work and what informs us, could we ensure that it's not just tokenism, that there is governance around that, and their lived experiences are embedded into this?
We have a tool on that, you know, it is about the most marginalised. Remembering the people who are experiencing drugs are across all class and all parts, but if you look predominantly to the overwhelming harm being caused, it's all the marginalised groups who've experienced trauma, who've had a lack of opportunities, who take drugs to cope and then get punished and criminalised for taking drugs to cope, and then they arrive in the services and in the structures and are punished further because of the lack of understanding about where they come from. So it is about having a structured approach to how we engage with those groups. It's not an add-on. Like, our toolkit is very clear about its principles and values, its process and its task, and it's making sure that people who use drugs are part of the design, the delivery and evaluation of everything. And like an example of that would be the research that was done, and it was specifically done by people who were drug dependent and who are currently in emergency accommodation. And they done a living experience analysis of the services from a human rights framework. And what they were able to do then was give an overall view of what the system is, but then more importantly, be coming up with solutions. And what we see in our services, when we just start with not the drug use and you start with, right, we're just going to give you agency, a voice and some power, and you're going to have value and ownership. What actually happens is normally people just progress through that, and then for a lot of people then they may decide, you know what, I might address my drug use, I might take less drugs, because once you give people ownership and value and a role in something bigger than that's beyond themselves, well then you can deal with all the other stuff. But you have to have a very targeted approach and a very structured process to engage with those groups.
That's great, thank you. Yeah, because I do feel that sometimes, and I suppose it's a criteria for services to be quite rigid when, I suppose, drug use and people who use substances, like you said, all walks of life, all people.
Well, it's just worth adding something real quick, because again, what can happen, and we need to be careful now around peer work, because everyone wants to do peer work, but if it's all completely service-led and state-led, we can get peers in. Peers think they're going in there to kind of be the voice of their peers and represent, but it can be really structurally set against them, and essentially sometimes they end up just being the voice of the service or there to promote the service, which is a different role. It might be an important role. So we have to be very clear around what we're defining, what we're doing and how we're doing it, because we can not only be tokenistic, but we can actually create more harm.
I think another thing to consider there is the lack of training from all aspects outside the addiction field. So social workers do very little on addiction in their training, doctors do very little, guards do none. So I'm lucky enough to be part of the Drive Oversight Committee for Drug Intimidation, and as part of the implementation of that is the guards will be trained in Templemore around drug intimidation. That's part of one of the suggestions. There's no training done on trauma. There's no training done on addiction understanding. So to this day, everyone is still treated as a criminal. And then you have unique people with unique empathy that will do it different, but as far as the system, they're still treated as criminals. and that's the lack of understanding and lack of education. And that needs to be resolved if you want to get people to come to your door instead of being shamed and not coming back. Part of it is the system. The system is wrong.
Did I remind you of another question? Or?
No, I think those are fantastic contributions. Thank you very, very much.
Thank you. Deputy.
Go ahead, Chair, and then I'll come in after.
Honestly, yeah, positive.
Okay, just very briefly, I suppose, just firstly, and just to clarify something that I said earlier, which kind of came across clumsily, I'm really conscious that addiction doesn't discriminate, and my question earlier about, I suppose I was asking about the circumstances upon which a woman would need to go in with her children, and I didn't mean to get into the whole profiling, but just to understand, you know, I suppose why they would need, and I think you addressed it with regards to risk, but just to be clear about that I didn't in any way mean to offend or anything like that. Just, I suppose, what I'm particularly interested in hearing is the relationship with the family support organisations and the local authorities. In particular, like I think, Joe, you spoke very powerfully there about that we don't have it hardwired into the training of Gardaí with regards to trauma, with regards to drug-related intimidation and all of that. And obviously there's a programme, the DRIVE programme is there now. But with regards to councils then, because of course, in terms of the whole housing aspect, so, you know, when that intimidation is taking place, and I suppose I'd just like to hear what sort of relationship you do have with the local authorities in your various areas.
I suppose just in terms of the DRIVE training, I delivered some DRIVE training last Friday to frontline workers, and we had a lot of the county councils come, and especially people from the housing departments. Great. Because they're actually having people come in that's experiencing intimidation. So they were very, very eager to learn. Delighted that the DRIVE project is in place. And I think there's a kind of a sigh of relief among a lot of us as frontline workers that something is bringing us together in terms of having a more integrated, structured approach to work with this issue, because we've really been working with it by ourselves, blindly, isolated in our different services for a long time. So it's nearly the perfect opportunity in that training room for us to share our experience, to learn from each other. And it was powerful, to be honest. There isn't enough of that because there's so many different areas, county councils, you know, the homeless services. Everybody's trying to hold their own and manage in this sector. And we don't have enough I suppose, reasons to come together, share our experience, share resources, know who to refer to. There's like such a gap in Ireland in terms of people don't know what's out there. They don't know about the community-based organisations. So that gives us the perfect opportunity, DRIVE, in terms of coming forward. And they are hungry for information and wanting to help people, wanting to understand and refer to us. So it was really, really positive.
Just from the Midwest perspective, and I think it's really successful and really highlights how interagency works. So we have a TNR meeting, a treatment and rehab meeting quarterly. There's all the drug services, including the funder of the HSE, the housing, counsellors, there could be guards there, and there's a body of people, and we all network and know each other very well. So sometimes you can't phone housing, say, listen, this is a desperate situation, do something. And they will, but only if a house is, or a bed is available, you know. But the relationship is really strong, and we don't work in isolation in Limerick. We absolutely do not. Everyone works together. And there's favours, and there's, you know, work a little harder here, and there's insights. And that treatment and rehab interagency model should be implemented all over this country, because we come together outside the DRIVE for every quarter, just to check in, what are you highlighting, what are you seeing, what's happening on the streets, how you respond to it, how can we help, is there an interagency piece, is there a collaboration piece, can we share funding on this training? And that works really, really well, and it's a model that should be really highlighted across the country.
Sure, okay, no, that's great to hear, because I think my own sense is that, you know, we don't have consistency across the country on that. I think we see different policies with regards to you know, that Band A, exceptional social grounds, and the eligibility for that. And look, there's a bit of a chicken and egg here, because there's so little supply. The bar has to be set all the higher almost for the most extreme of cases. But I suppose it's that recognition that drug-related intimidation should be very much part of being seen as an exceptional social ground, you know, when people are looking to transfer or indeed to access housing. Anyway, enough from me. Thanks, Chair.
Thank you, Deputy. Deputy Colin Burke.
Yeah, thank you very much. My apologies for being out there. Just other meetings to do. And you may have touched on this already, and that's in relation to the growth in the availability of cocaine. And, you know, when you look at it over the last 2 to 3 years now, or even over the last 5 years, what kind of percentage growth have we seen? And then as regards to the number of people adversely affected, like for instance, you take in relation to the area of heroin at the moment, you know, I signed the license agreement for the for Merchants Quay project on the 21st of December 2024, and it opened on the 22nd of December. Between that and the 30th of May, there were 4,000 attendances there. Now, that's not 4,000 people, it's about 670 people who used the facilities in Merchants Quay over the following 5 months. But just in relation to cocaine, you know, there's been a huge growth, and how is that now, the challenges, the new challenges that poses that weren't there, say, 5 years ago? So I'm just wondering if there's anyone who would like to deal with that.
I'll just give an answer. There has been an absolute significant increase in those presenting for treatment for cocaine, but I think what's really important, and it keeps getting drowned out in most media, alcohol remains the largest substance for which people are seeking treatment. We've 18 services, Coolmine have 18 services across Ireland. Cocaine is the highest drug for which people, but actually alcohol is dominating every service across the board. And it was when NDTRS and the HRB separated out alcohol and the drug treatment presentations, and they separated out alcohol. That's where sometimes the distortion in the numbers, where it looks like cocaine is actually dominating across, alcohol remains the biggest. So I think just sometimes what it is, we sometimes need to not forget as services and not do react in all our services to address the cocaine needs, where actually alcohol is still the dominant substance for which people. But people have, I do have to say, you know, the HSE got very, very active, and I was actually really impressed at how activated they became with the surge in cocaine. There was cocaine programs initiated right across the country. Funding did become available, I think, to most counties, because interestingly, it was a drug that absolutely didn't discriminate. So it actually went across every region, every county, every age, every gender. So to see, and I do have to say, there was a really, really rapid response for services to then address the needs of cocaine. But we must not forget that there's other substances, you know, and I do keep hearing that opiate users is aging out and there won't be any. We still see plenty of opiate users. I still look at how many people are still in receipt of methadone. That will tell you that the opiate users are still there. And we just need to be careful as service providers that we don't start moving our services to just respond to one drug only.
Okay.
We just add there, just as well, so it's really the age of polydrug use. As has been mentioned by Anita, like cocaine has massively increased, crack cocaine has massively increased. What you'll see very prevalent is people are taking multiple drugs. Alcohol, cocaine tablets, crack cocaine, heroin tablets, crystal meth. So just to be conscious that there's multiple drugs and they never end in supply of new drugs coming onto the market all the time. So just being conscious of how we respond collectively to all those drugs, how informed are we on drug checking, but also understanding that there's underlying conditions behind all this. Like, there's a huge issue with crack cocaine across the country now, and most of them are people that probably would have been just taking heroin in the 80s, so they come from the same backgrounds, the same community, the same trauma. So again, trying to recognise and respond to the polydrug use, but also really getting underneath and trying to address those underlying conditions of why people take their hardest of drugs more prevalently.
And just in relation to the whole issue, in relation to education programs, both in relation to whether it's in relation to any substance abuse, is there a lot more that we should be doing within our educational system to highlight the risks that exist? I mean, some people can take, say, a drug and it doesn't have an adverse effect on them. other people can get addicted at a very early stage. And I'm just wondering what you feel should be changed in relation to the whole education programme on this.
Thank you, Deputy. I'm seeing everybody nodding. Anyone want to?
I think, you know, our whole policy, when I look at kind of national drug strategy after national drug strategy, early intervention barely gets a recognition, you know, and realistically it should be a pillar all by itself. Early intervention, so we were talking about earlier, you know, parents who use drugs, their kids are at the biggest risk. Where is the early intervention happening here? So we can talk about general school approaches and going into schools, and I think what we just need to remember is any single person who uses drugs does not think they will become addicted. So regardless of whether they're 13 or 14 or 15, many people who use drugs will not become addicted. It will be recreational drug use. They'll start, they'll finish, they'll get on with their lives. And there will be that certain proportion, as Andy was saying there, that all possess a certain different characteristics, coming from the same trauma, coming from the same backgrounds, coming from. And these are the children we need to target. There needs to be targeted approaches. So I did mention the types of PUP. PUP is for working for specifically with parents who use substances. So these are raising their kids. They're you know, they use a substance. Actually, there's targeted programs of how do we get in at these parents to actually support them, because that way we will support their kids instead of the intergenerational. Because we do look, you know, there's no denying the intergenerational cycle of addiction. You know, every time we do carry out a lot of research in Coolmine, and it's consistent. 80-90% one or both parents with addiction issues. So we can't ignore evidence that just keeps circulating about. So
but
we
is there,
really need to focus on the prevention.
Deputy, we're going to have to move on.
Okay.
Thank you. Senator Mary Fitzpatrick.
Good to hear, look, and apologies that I had to leave, and thank you sincerely for being here today and for the work that you do. You, Joe, you really articulated very eloquently the impact, the experience of the family member, the loved one, when somebody you love suffers from an addiction. It is really horrific, and I just want to commend all of you for the work that you do in family support and supporting people in addiction and onto a road of recovery. It's incredibly important work, and it's largely unseen work as well. So I just want to acknowledge that and thank you for it. I serve myself in a voluntary capacity as a director of a family resource centre. So when you talk about the challenges of the funding and the recognition as stakeholders and that, I get that, and support your call to have adequate funding and for proper recognition as stakeholders. I unfortunately have been back and forth because we've got other meetings on today and the Seanad is sitting, so that's why I wasn't here, but all of this is recorded and I have all your opening statements, and we'll be working with the rest of the committee, so please do not take any my in and out as being in any way disrespectful. It's not intended that way at all. I have some questions actually, I suppose, and I think I'll put the questions to each of you. In relation to the new drug strategy, I suppose, Andy, you started out and you very clearly called out the stigma issue, and it's real. There's no doubt about it. As a society, there's huge stigma attached to addiction, and I'm wondering what suggestions, if any, and I'm not asking you for a magic wand answer here, but you know, are there societies, are there jurisdictions that there are models that we could learn from and that we could adopt and we could suggest including? And in terms of the prevention, Anita, you mentioned it, early intervention and prevention. They're just not focused on enough, and I suppose that's, you know, just a missed opportunity. And I think as a committee, we've a real opportunity to try and put some increased emphasis there. Not to say not to put the increased emphasis on the other areas as well, but each of you, if there was one thing that you think we should be looking to prioritise in terms of prevention and early intervention, I'd love to hear from you on those. And we can start with Andy, if you want to come in first. And
yeah, look, stigma, it's an important issue, and I know from myself, personal experience, when you go from being a recreational drug user to becoming drug dependent to then becoming someone who's using hard drugs, everything changes. Everything. You become a pariah, and you become something that's a problem, and like that's when people take harder drugs and take more risks, because you feel like you have nothing left to offer. So challenging stigma is important, it's valuable. We actually done a piece of research, peer-led piece of research, because they were identifying how embedded stigma is across the systems, and it's intersectional, and it does go back to how we criminalise people. Like, we view people in addiction differently. We view people who have a gambling addiction or an alcohol addiction to a drug addiction vastly different, and it is linked to how we criminalise them. And then the criminalised approach gets embedded in kind of a stigmatised approach across housing, across healthcare, across mental health care. So it is around trying to do, our peers decided what they really need to do was do a piece of research, and they looked around and they said some of the research was limited because it didn't really highlight how structural it was. So they highlighted the structural nature of it. Then from that, they've then developed a proposal that there needs to be a peer-led national campaign and peer-led training that goes into all the various services. And you need to start at the community and start at a national level and really start to kind of unpack it and drive a wedge through it, and even just around kind of like people who may not be marginalised or maybe middle class or upper class or become from different parts. If you're a GAR player who works in the bank, are you going to go into your job tomorrow and go home to your family and tell them that you have an issue with drugs? No, you're probably going to wait till it escalates. So stigma affects everyone, and what we need is a structured approach to try and unpack it out of the system, and that needs peer-led anti-stigma campaigns, it needs peer-led training, but it also needs to commit to decriminalising people, because as long as we commit to criminalising people, we will commit to causing undue harm.
Yeah, thank you. And in terms of the prevention, early intervention.
Well, I'm just thinking I might, because maybe someone else, because I don't want to hog all the space, you know.
I didn't realise the clock. Yeah, sorry.
It's okay.
10 years working with adolescents in drug use. So you're talking about early prevention and early intervention. That can only happen if a person feels safe enough to say, there's problems at home, I need help, right? That can only happen if the person they're speaking to is educated to understand trauma, understand poverty, understand when a kid flips over a table, it's just communication. And know, how dare you do that in my class? That's ridiculous. What you should be looking at, there's a child hurting in pain and they're trying to tell you something's wrong. So the prevention part and the early intervention is actually from the other person, because if I have someone that I can trust, or I feel that understands me or loves me or wants me in their vicinity, there's a better chance I'm going to stay safe. But if I feel that I'm a dirtbag and no one wants me and they call me scumbags, or you get out of my class, then where am I going to go? I'm going to go into myself and I'm going to use drugs to make me feel better. So if you want early prevention and intervention, educate the people that are supposed to be our role models in our lives, even outside of our parents. I mean, the school and the community guard, or whatever the case may be, that they see you for what's really going on in your life, as opposed to a problem that needs to be solved.
Any other contributors wish to respond to Deputy Fitzpatrick?
About early intervention, and we can't at all keep ignoring it, which is why I suppose children are very, very ever rarely mentioned in any national drug strategy. I did look with 2 actions, and all what they were referenced was in terms of hidden harm, identifying risk and mitigating the risk against children. That was the extent to what our current national drug strategy addressed children. There was absolutely nothing in it. We don't have any national protocols, and we've 2 departments, and we can't escape that reality. There's 2 departments with total responsibility. So what we have at the moment is that early intervention can't happen because there's no clear national protocols. First of all, who holds the lead? And there's no reason why it can't be done. Many, many years ago, there was good practice guidelines developed from methadone prescribers and addiction, where they were often in kind of quite conflict with how each other worked. Following work together, there was national guidelines developed. There was good protocols where actually both considerations were taken in, and there was agreement. And if we're talking about early intervention, Joe just said it there, people need to feel safe. When we're talking, and we really need to, why parents don't, Anne-Marie talked about it earlier, why parents don't and have to wait until it's right at the end, their backs are against the wall and they've nearly lost everything before they can seek treatment, is because they are terrified their children will be removed. That is not irrational. That is irrational. And it's been compounded by policy every time where people are talking about mandatory reporting of people seeking substance misuse. Are they a parent? There needs to be mandatory reporting. So, you know, Andy talked about, everybody's talked about it. It's not punitive. We can never do prevention. If somebody then feels, I feel like I have an issue with alcohol or drugs, I can actually go to my primary healthcare centre or my GP, and it is held under a health-led approach. That I have an illness like anybody else and I need to get a treatment, you know, that's where, and then the services have to be provided. But at the moment, we do need to recognise it is very rational that parents are terrified to go in and seek help.
Thank you. Deputy Graves, would you like to come again?
Yeah, just very quickly. And thanks all for your contributions. I think one of the points I got was the lack of involvement of all of your groups in the development of the new strategy, and I think that's been raised. And we had the chair and secretary of the Citizens Assembly here last week, and their understanding was that everybody was supposed to have a voice. So I think we'll probably be following up on that again. I think everything has been covered. One question I have for you, Joe, and it's about the drug intimidation. And it's great that we have the DRIVE programme and it works very well, but how do you get people to buy into it? Because there's loads of cases where people will say, look, this is happening to me, but they're terrified, absolutely terrified. And in terms of, you know, housing and replacing them, like, Ireland is a small country. If somebody moves from one house to another house, they're going to be found. Do you know what I mean? And particularly where I am, it's Fingal, you know, everybody knows everybody. So unless they're going to get a new identity and move them to a different country, you know, which isn't going to happen, like, how do you get people? Now, I've had 2 cases very successfully fought through the courts, really worked well, but the only reason the people went ahead was because they had absolutely no choice. They hadn't got the wherewithal to borrow money. They literally had no choice, and they won. And the cases were successful. The vast majority of other people are borrowing money, credit unions, banks, you name it, to pay off drug debts. So, just if you have any, you know, idea on how you can encourage people.
It's back to the safety basket again. So the end result of DRIVE is not to have everyone come and bring everyone to court for drug intimidation. The whole point of DRIVE is when a family is at home, terrified, not knowing where to go, don't know how to pros and cons of decisions to make, is they can come in and speak to someone that will help them problem solve what they want to do next. Obviously, there is an influence between the guards, and in some areas it works really well, sometimes it's others. We had a situation recently, and the DRI inspector came in, and the person he spoke to felt very relieved after speaking to him, with no obligation to do anything. And then after that, he sent another person from his team to speak about kind of preventive measures you can take to make your home feel safe. So you can be, you know, moving things around, the video cameras, different things you can do to feel safe while this is going on. That was a really good intervention. You know, the people will be given an obligation or a choice. Do you want to go forward with this or not? It makes no difference to me. Right? The whole point is we're there to help you, whereas before you were lost. You know, so the part of the training is to want to identify. So if you're working in the credit union and I come in and take 10 grand out, and I'm there a month later and I take another 10 grand out, show what's going on here. So you're trying to create, and same with the GA clubs and all that, because cocaine is massive, big money, people are getting to debt really quickly, you know. So it's to help people to respond to that. A number of people will probably come in front of the court and say, I want to do that. Others will never ever do that for the same reasons you just said. But let's offer them support. The other aspect, the real pillar of it, is the NDRS to get the stats. There's no stats in this country that can tell you the level of drug intimidation. That is now after being created. And once that's there, and the evidence is in front of the government and the Gardaí, you now have to respond. And that's where it's at the moment. It's building those kind of foundations to get a true reflection, so that actually then money can be put into the proper areas that need to know where it goes. That's really where it is.
Maybe a few years ago called Young People in Contemporary Ireland by Anya Lawler and Maurice Devlin. And it stated one very important thing. Young people want 3 things: money, status and power. And how you acquire that in one area of Dublin and one area of Limerick or one or to another is vastly different. So what we need to do as a society is really go back to basics and say, why do we have a never-ending supply of young people who are willing to take the hardest of drugs, and why do we have a never-ending supply of young people willing to sell drugs for economic opportunity? And we see now an over-representation. It is to do with the housing crisis. It is to do with opportunities. It is to do with, we're actually seeing more and more people come into emergency accommodation, right, who never would have been in there. We're working with loads of young people who, most young people who take drugs will take drugs recreationally. They'll eventually do a cost-benefit analysis. They'll never become drug dependent and they'll move on with their lives. But that happens when they get a home and they get a partner and they have a family and they get a job and they do all those things. When those things become hard to get or they can't get them, we've seen more and more people who are getting their partners having a baby. They have a job, she has a job, they can't get a home, they ended up in emergency accommodation. The father then can't see the kids, the new baby, because they're being brought in. And the longer then those people are in that system, their needs actually become more complex. And that people that never would have become drug dependent and getting involved in the criminal underworld are getting involved. So, like, the social determinants and how we're addressing the underlying issues are vital if we're going to have better outcomes for people.
Perfect. Thank you. Deputy Graves. Oh, yeah. Aileen, of course, you can.
About Drive. Any of the people that I know who have faced drug-related intimidation, they've not gone to Drive. They don't know about it. It's only really if your loved one is availing of services, is in some kind of, is linking in with services that you might hear of it. Personally, I know people who have borrowed huge sums of money from the credit union to pay off debts. I know somebody who's sold their house and is now living in a little shed in their other child's back garden. Do you know, it's a huge problem. When we had the conference there in Dundalk, 53% of people said that they were under extreme financial and drug-related financial stress and drug-related intimidation. So there's a huge cohort of people out there, of family members out there, whose people are not availing, whose loved ones are not linking in with services, and therefore they don't know about Drive. They do not know that there are supports and helps available to them. And we're failing those because always, and even with children, with families, we're tending to link the children and families with the person who is in addiction. But unless the person who is in addiction is availing of services, those children and families are getting lost.
Thank you, Aileen. Rory, Deputy O'Murphy. Yes, of course you can.
Sorry, I just wanted to say after reading there that in FASN and the family peer support groups, we had a questionnaire with the family members that were in there. About 85% of those families had paid debts. I had never mentioned it, that they had paid it at all, because it has become so normalised for them. So there's another perspective as well coming there. They've accepted it and this is what they're going to have to do.
Thank you, Graham. Deputy Morgan. Oh, yes. Oh, my God.
I think this is really, really important.
I think it's so important.
Right. So but I also think families don't mention it because we go back to the shame. Yeah. They won't even mention it to their own family that they're paying debts, they're going to credit unions. So it's all around the shame, the stigma, and the whole lot. You know, that's at the core of paying debts. And also the person could be their next door neighbour who's demanding, depending on the area they live. And again, we go back to postcodes.
Thank you, Michael. Deputy Morgan.
Michael, look, in fairness, a lot of it's been said right here. If we're talking about alcohol and cocaine, like we've always had an issue in relation to alcohol here, we've never been serious around it. Cocaine does cross every strata, but when you are dealing with the worst cases, you are talking, or you know what I mean, or the communities the most put upon are obviously disadvantaged communities, and I get that they've changed in relation to, you know what I mean, the setup that used to exist, but it is that poverty, it's multi-generational trauma. It's also here, it's seeing the bad example when you know that you're not necessarily going to be a Rhodes Scholar and whatever, but you can see your man in the corner and he's been operating for 10, 15 years and nothing really happens in relation to him, or that is the perception, you know, in relation to and that's the particular issue. So I am going to ask a question in relation to what does a national drug strategy, taking into account, you know, family supports, what does it actually look like? And just the point I would make around the Family Addiction Support Network, obviously not only providing supports, but again, there are people who are still afraid to go to the guards, particularly when they are dealing with drug debt, intimidation and whatever. I know I've sent a number of people myself, but also it's an outfit that almost closed a number of times. Like, we are not serious about having the conversation about addiction, but we're also not serious about resourcing what needs to happen and putting a proper framework in place. And I will also state, like Joe, I've gone to the guards multiple times on drug debt intimidation, and the guards, when you actually get people over the fear factor, and even in some cases people have stood up and haven't paid, you know what I mean? And again, there's people who have paid once, and on that basis somebody lets the dealer run up a tab again. Sure, that's it. What they didn't realise is they were able to get the credit union loan, or they were able to cash in a pension or something that they can't do the next time. You know, and then we've all seen places that have been absolutely burnt out. But the difference when you go to the guards is, at least you're putting somebody in highlights, not even in relation to drug dealing, in relation to violence. And I think that's something that is absolutely necessary. But again, I would be afraid of my lives that we are not going to have the framework that we need, because I don't think we're addressing the need, the requirements that are out there.
Thank you, Deputy Morgan. Would any of the contributors like to respond to Deputy Morgan? Yeah, Andy, please.
We rightly so are talking about a health-led response. It's not even just a health-led response. It's a social and health-led response. And the National Drug Strategy is always going to be limited, because this, and it was said in the Citizens' Assembly, and it's named in the strategy stuff, but this is a comprehensive national approach, cross-departmental, and unless we do that and it addresses all the underlying issues, it's to do with housing, it's to do with education, it's to do with employment opportunities, it's to do with better communities and better futures. So, like, we need to be really, like, it's okay to have a national drug strategy that might mention some of that, but unless it's linked into a broader housing policy, or like a lot of the problems that we're seeing now are linked back to the failed housing policy, you know. So we're always trying to play catch up and fill in the gaps, and we need to have interventions and we need to have preventative measures. But unless we're looking, like, again, going back to that structural analysis, listen to people who use drugs, listen to families, listen to communities. People know what the issues are. People have been saying what they are for 30, 40 years. It's not rocket science. It's I think sometimes we might, and it came up in the Citizens' Assembly where there was kind of like a bit of a kind of demoralised approach at time that, look, this is just like a wicked problem, as in like some mad problem that can't be fixed. There are absolutely solutions, and they're absolutely linked to poverty, linked to power, linked to kind of the social determinants approach. Because if we don't address all of them, we'll just keep trying, and we'll never catch up. And we'll always have really good interventions and really good responses, and plenty of them have been laid out. And we need to continue to have this. And I'll say this, like, for Inishka, we hope in 30, 40 years that, look, we need massive interventions and investment in funds in services. Now, we should be saying in 40 years, how about if we had less services? Or if we had a decrease in services, or a decrease in responses?
Does
proper targeted.
Michael, I think you wanted, did you say you wanted to respond to?
The deputy asked around, you know, what's for the new national drug strategy. The last one, when it was reviewed, and like all the answers are in that. You know, it spoke about the collective inputs and importance of embedding stakeholder voices, the lived experience within that, and the continuous improvement of drug policy. It also talked about community-led and peer-driven initiatives were highlighted as promising in promoting recovery and reducing stigma. But then it talked about the inconsistency and the implemented and frequently underfunded. And again, we're going back to the answers are even in the review of the last. So, like, and we need the voice there. And the voice in the previous strategy, the voice of the families was in there, was supposed to be in as part of the NOC, the National Oversight Committee. And when the last National Family Support Network closed, that voice hasn't been there for the last number of years. It needs to be back in. The lived experience has to be in there as part of the policy decisions and part of the implementation. And it's not just a matter of writing it, it has to be implemented.
Thank you, Michael. Thank you, Deputy Morgan, for your questions, and thank you, Andy. I suppose we've gone full circle, and I haven't actually asked any questions yet at this point. So I think for me, is there any, you've all given up your time, your expertise, taken out of what are very clearly very busy days. Is there any particular question that hasn't been asked of you? Is there a point you were making that I interrupted? Is there anything you would like to make this committee aware before you leave in terms of, so each, feel free to take a minute to, yeah, Yvonne.
One thing that was probably not mentioned, well, I didn't hear it mentioned, was the isolation that you feel. And actually, the isolation can be from your own family as well.
So in the services, when you go into the services, you're able to express that because you can't speak to your family, because I have a son in addiction, cocaine, and like I have had people come into his job and saying, get into the car and take your wages out. He never told them where he lived, thank God. But my family would have isolated me, not spoken to me, because I bailed him out, because else he could have been murdered. And that's not being dramatic, but yes, they were drug dealers and they were looking for their money. So it's the isolation from your own family, because now they're not speaking to you, because your son, whom you gave birth to and that you loved and that you hated all at the same time because of what was happening. It was the isolation part of it. So I suppose that the services are there and they're fantastic in the peer support groups, that you don't feel isolated. There's many more people like yourself in there, and families are treating them the same way, isolating them as well, your own family.
Thank you for sharing that experience, Yvonne. It's really important. Anyone else?
We done research last year. Quite a lot of it was to measure the complexities of the people that come in our door, because they come in focusing on their loved one, but by the time they settle in and we're going through the programme, then the focus is actually my own upbringing and stuff like that. We moved into counselling and there's a journey. And when we done the research, we went into the national drug strategies looking for the definition of complex needs for families, and there is none. There's never been any. And so we done our own research with an interagency, including participants and other services, to come up with a layman's term for complex needs that should be put in the national drug strategy. And I've sent it to all of you. I'd like you to review it and consider it to be put into this year's strategy, or this strategy.
Gwen or Cindy, if you anything funny with us?
I suppose just the only point I would make is just to echo, I think, a little bit about what people have said today in terms of the importance of early intervention. Just in our service, we work with over 18s, but I'm very aware with my clients that there would be a number of children under 18 that there is no specific services. And when I say that, I mean, I know there's great parenting programs and everything out there, but I mean addiction informed, trauma informed. You know, just in my area in Monaghan and Cavan, there's Macy's and they work with kids from 11 up. But underneath that age bracket, there are a lot of children being affected by addiction in the home, and there's little or no services available for those children. So I suppose I just wanted to highlight that. That is something that really needs to be looked at and taken into account.
Thank you, Cindy. Anne-Marie, Andy?
It's just a lack of services, like outside of Dublin and down the country, and that, like, there's a youth club in my town, and the kids have to be in trouble to have access to that youth club. Like, that shouldn't be the way. It should be for every child. And a lot of that brings peer pressure then as well. But like for women and even men down the country, there's no services. Like, you have to travel to Dublin or you have to travel to City, and the wait times then, Tussla are coming in and saying, you know, we're going to take the kids, you have so long to get into treatment. There's wait times to get into treatment. You have to have like clean urines to get into treatment. There's a process that goes with that, and you're not given that chance. So I think that needs to be looked at as well, just for mothers in addiction to be given that chance to go through that process and come up with a solution.
Thank you, Anne-Marie. Andy?
We've heard it today, but we need to really commit, and it needs to be mandated to build the infrastructure. Like, if you want to listen to people, it takes an infrastructure, it takes a structured approach. And I'll just quote, there's a couple of quotes here very quickly that from participants about why they don't make complaints or why they don't have a voice, and we had like none, no impact, nothing happens, still homeless, still in the same situation, none because they don't follow up with them. I feel like I'm living late today and I want to give up. More drug use and more mental health, more trauma from being let down. My mental health is not good and they just send me from pillar to post. I have lost hope for myself and my kids. I am only young and I see no future. I'm trying to get a care plan for 6 months and need one to see the counsellor. So it's important we have a framework to listen to those people so they can tell us where the gaps are so we can create the solutions. And I'll just read one other quote then from our annual report, which is based around all the peer work that's happening. It says, I just think it's very important to give people who would never have a chance at getting their life back, because when you're in a person who uses drugs, or you want to come off drugs, or you're off drugs and you're about 40, there's nothing out there for you, nothing. And this place for me is just, I know I always say for me, I want to give back, and this is my aim, to give back, because I took so much from the town, you know.
society has to be aware of. People who use drugs are often not living their lives. We're surviving. Every day we're fighting to survive. But places like this get a lot more people would speak out about where the barriers are within the system and service. You'd know what's out there for people as well. You can point them in the right direction. So again, what happens when we don't listen to people and what happens when we do listen to people. So have that framework.
Thank you, Annie. Anita, Suzanne?
Just as a mother with 2 small children, that when I went into Ashley House, residential, I had been given all the supports. I had been given a key worker, but my children had also been given a key worker and given supports in the creche on site in Ashley House. But when we came out, for the transition period for me coming out, yes, I still had my aftercare, I still had my support groups, my fellowship, and all them supports were there for me. But the supports for my 2 children stopped. There was no play therapist, there was no further on key working for the children. They were transitioning out of a treatment centre also at a young age. My 5-year-old does have behavioural issues at the moment, and we're still trying to get her linked in with play therapists and some kind of supports for her in around her emotional regulation. And I just hear words that it says addiction does not affect only the individual. Everything that the person with the addiction is feeling in terms of the shame, the guilt, the remorse, the family member is feeling that too. The dishonesty, the hiding, the not telling that you've paid the bills, the shame of having a child as an addict or a sister, and what that impact is on the family. And that goes for the children also. They're feeling that too. They're unheard, they're unseen, they're not given a voice. I have come from a parents of 2 alcoholics as well. I didn't have a voice at a very young age. The family was torn apart. There was no one stepping in to help us. And I am intergenerational. Now I have a sister as well who isn't an addict, do you know what I mean, who has never suffered. But I did. If someone had stepped in to our family, people knew, neighbours knew, schools knew. If there were supports for me at that time, maybe I would have had a chance. But I'm saying for my children now, to support them, they need the support. They're being impacted hugely. And to stop that intergenerational, that needs to happen now for them.
Thank you, Suzanne. Anita?
Yeah, just really absolutely highlighting what Suzanne talked about there, and we were talking about early intervention. There is many services around that can treat people with substance misuse. I think what we've heard today is families, children, everything, they need to be treated in their own right. Recovery needs to be seen through the lens of families. Recovery needs to be seen through the lens of children. Unless we have strategies within the national drug strategy that recognises them in their own right, they will become an add-on. They will become an add-on who's providing at the end of the year what services can provide that really, really quickly. Without any good strategy. So just when we are talking about early intervention, we are talking about, when we talk about hidden harm, many of our children are not hidden at all. They're not hidden. It's as Suzanne talked about, the schools know who they are. The neighbours know who they are. Everybody in God's earth knows who they are. But if we're only given an option of, it's my fault, that child gets taken off them, all what it does is put people into, again, shrouds of secrecy and silence, and just people operating in pain. So until it is they've their own strategy, that they become their own pillar in a strategy of what is the supports need of families, other family members and children, and actually what's in place. I tell you, I think if we even done a scoping exercise as an initial, I think there'd be absolute shock, because there's going to be counties in the country that have no family support services, that have 0 services for children. And then even within counties, they might be just in the city, the part of the city, but actually there's nothing in place. So I think that's where we could start to see where the needs are. But I just think in a national drug strategy, I do think it needs to be national. Because unfortunately, sometimes the loudest mouth that shouts loudest will get, and this also includes areas, it includes, can be in personalities and can be in relationships. And I think if we're really ever going to be able to do anything about a national drug strategy, it shouldn't depend on relationships. It needs to be national and more the national needs of the country.
Thank you, Anita. Michael?
Follow that. No, again, unfortunately, within services, you're nearly pitted one against the other for funding. And that makes interagency work extremely difficult at times. But I think when we look at it, at a national level. When you look at the Rise Foundation, when you look at FASTN, a peer-led organisation who has worked alongside the Rise Foundation, we have seen how interagency work can really be beneficial to everyone, right? And that's why, you know, when we look at the work that can be done interagency, and somebody to oversee that and look at it and look at best practice, and even for the peer support, we talked about it in that, like the evaluating the peer delivery and the best practice. You know, this is really what's needed as well, so that everybody right across the country is getting the same service, and that the same service is available to everybody.
Thank you, Michael. Aileen?
It's very difficult to follow this, but all I can do is echo and completely agree with them, and say that if we are serious about tackling problematic drug use, that we look at all the people that are around the person in addiction and that we help and support them, but that if we take a long-term view, that we're looking at tackling intergenerational drug use, and that we're prioritising children, and that we are putting the supports, proper supports. I mean, we look at the moment at the whole chaos around crash places and everything, and then we put proper supports in for children. We also take account of neurodiversity as well as trauma as well, and put a lot of resources into that as well too.
Thank you, Aileen. And finally, Senator Frances Black.
Thanks very much, Cathaoirleach. And firstly, I just want to say I'm sorry I can't be there in person today, and my signal wasn't great today, so I was only picking up on some of the conversation. But I just want to say it really has been a privilege, to be honest, to be presenting here today with such phenomenal organisations who do brilliant work. And I really think that it's absolutely vital that with appropriate funding and policy support for all of these organisations who are doing great work, and it is about connecting the dots and that interagency work and us all working together, because we all have the same aim. We're all working for the same thing, and it's just about getting that awareness out there around the impact on the family and recognition of the importance of family support is so vital as part of a comprehensive public health approach in Ireland. And it really, I think, doing this work will reduce the long-term human and societal costs in general going forward, and us all working together could really break the impact of addiction and break the legacy of addiction, and it really does strengthen the fabric of families across all communities. But I just also want to say I do think it's really important we do need that national body, someone like FARI, that could be the umbrella group for the voice of families that are impacted by problem alcohol, drug or misuse. And I think that's really, really important. So, yeah, but I do really want to pay credit to all the amazing work that's happening here today. And it really is a privilege to have been here alongside you all. So thanks very much, Cathaoirleach, and thanks to the committee, for your time today. So, Gurmira Haggard.
Gurmara, Senator. Yeah, and just to say from my part, it genuinely has been a privilege to hear the extent of work that you do, the heart that you bring to it, and the difficulties that you have to overcome in order to deliver services that are just based on kindness, decency and humanity. It never should happen to be so hard, but thank you. For our part, we've all been better informed from your presence here today. I hope when we have our final document at the end, it captures exactly the reason why you came in there, that we'll have a template for what will be a better Ireland in terms of how we treat and care for people in issues of addiction. So thank you, and yeah, thank you again, and thank you to everyone in the committee. Oh, Tim, I have to say the meeting is adjourned. Cool.
not sure there now. Is the mic actually working? Jeez, had some issues there getting the mic working there, so I think I see some bouncing going on in the audio. Nice one everybody for tuning in anyway. We'll try to keep these going on a weekly basis as the meetings happen, just for people who are out and about. Yeah, I'm very quiet. Nice one. What's the story there? So, let's see. Yeah, seems like there's some issues there anyway, but we'll try to fix that there before next week. But nice one, Daily Talker, there for keeping me updated on that. I was going to look back later and check what it was like. It seems quite low, alright. I don't know how I can actually get her up anymore. Hey, that's what she said last night. Whoa! Oh, you dirty-minded people. I think I had a filter on her or something before. Did I have to bump up the audio? Sorry, no, just gonna mess around with this. Does that work any bit better? No. It seems to have actually bumped it up a little bit better, but there's definitely seems to be a bit of noise in the background. Whatever that's about. Yeah, nice one, Daily Talker. I'll fiddle around with this there later. I'll do some private streams and fidget with it, but it's been good being back on here. It's been good getting the studio up and running. I was kind of panicking beforehand. There was a lot of cleaning and reorganising to be done. It was a while since been out here, having to put bits and pieces back together because I had to take the whole desktop and all of that stuff out of the studio as well, put it into storage. But yeah, Gabberhead, what's happening? Can hear you just low, but yeah, as I said, I'm just having some issues there. Not too sure what the crack is with the mic and all of that stuff. I think there might be a problem with the soundboard. Could have got fucking damp on the inside or some crap while it was being stored away. But yeah, we'll see what happens anyway. Hopefully we can have it all sorted before we get back here next week. But nice one for tuning in anyway, guys. I'll leave you all go enjoy the rest of your Friday. Have a good weekend. Hopefully you're all enjoying something nice and doing something good. I'll be enjoying it myself with the family. So peace out, guys. And I'll stay blazed. Keep her lit.